Quit pointing at me. Good evening, gentlemen.
It's like Wayne's World. You know what I'm talking about? Like the 3, 2, and then they make him do the, that. That's exactly what I felt like just a second ago.
We're on. Okay. Good evening, everyone. I'm very excited and happy to be here with a couple doctors tonight. The first time we've done this kind of format. Everyone knows Dr. Roy. We are on our 53rd together. This is Mark's number 53. For those of you who tried to watch 52, they disappeared from YouTube and Spotify because they didn't like us playing music. So we're going to do a little editing. Travis is going to rework that. But if you want to watch it, they're just still on Rumble because Rumble is more of a free speech platform. Anyway, super excited about Dave being here. Second time he and I have sat down. Before we kind of let Dave tell us a little bit about himself and what he's into, and what we really talk about, I'll let Dr. Roy talk about, give it a little bit of an intro again. It's been a minute since you've done that.
Sure.
So for the people watching for the first time, today for me, this is really about bringing two intelligent doctors to the table, folks that are not afraid to speak out, to things that they've seen over the last 5 years. And, the goal for me is preventing some of the same things that happened to us in the past from happening again. And I don't feel like the media is holding anybody accountable. I don't feel like there's enough physicians or dentists that are really out there acknowledging what happened and just being open to like, okay, if this happens again, what are we going to do? So basically that's what I'm trying to do, is establish a team of guys that can come together and start recognizing things, and we can hopefully get some early signals out. Before we get too deep into any of it though, Dave, could you tell us a little bit about yourself?
Yeah, I had a family practice dental for 30 years in Newburgh, and had several associates that became partners that eventually bought me out at the end of 23, so I've been retired. We sat down together, what was that, early January? I think.
About 4 months ago, something?
I think it was, yeah. You'd contacted me and just kind of wanted to go over some of my thoughts on some of the new products that were out, as well as the old ones like the fluoride, and kind of where it fit in, and kind of gave you my perspective as to kind of what I saw as the trends, and just kind of my philosophy of the things that I've seen and things that needed to be improved in dentistry. Mm-hmm. So, this is kind of part 2 here tonight of bringing on some other ideas. Some of it's kind of expanding outside of my knowledge base from the medicine standpoint that Dr. Roy will have here, but sure. Chip in where I can and fill in from the dental side.
Well, that's a great point. And there's, obviously you're not going to try to speak over Dr. Roy when it comes to specific things.
That was funny. He said, fill in.
So, a lot of the things we look at are more broad and not necessarily specific medical related stuff. It's just industry kind of related stuff. And, I'm not a doctor, obviously, but we all see things that are happening around us, and we're curious and we're concerned, confused a lot of times, and we don't know who to trust. So a lot of it is, again, just bringing your knowledge to the table. What I loved about our first interview is you were willing to take some of the questions I had about, fluoride, and some of the questions about alternates to that. And we talked about nitric oxide and how that affects overall health, which overlaps a lot into, I think what I am curious and interested in, hopefully these conversations continue with both of you sitting here, is I think there's more overlap between the two things that you guys do than most people think about. I mean, general health, it starts, you got all the oral stuff, which he looks at some of it, but if there's a tooth, he's going to send somebody to you. But I mean, I think there's just a lot of overlap towards health that we haven't really got into. So hopefully we can dig into that. Dr. Roy, why don't you give people an update that might be joining in for the first time, or maybe they haven't heard your experience, and if they've been only listening for the last 4 or 5 times.
Well, I graduated from medical school in 1974 at the University of Alabama in Birmingham, and then took a year after that, I worked with a group of internists in Selma, Alabama, and then came back to the University of Alabama in Birmingham to finish out my residency in internal medicine, and then did a 2.5-year fellowship with pulmonary and critical care at that time. I've also had a lot of experience with trauma, having worked in the Air Force, and we all had to be trained for trauma. And I said, man, I just pass out pills. And they said, no, you're going to learn how to do a bunch of other stuff. I already knew how to put in chest tubes, and actually was teaching everybody there how to put in chest tubes in goats. But anyway, so I've had a fairly long career, some of it in the insurance business, and most lately about 12 years of working internal medicine mainly. I've got some pulmonary patients, but mostly internal medicine. I closed my practice in Evansville in 2023, and thought I was going to be doing nothing, but it turned out that a lot of my patients said, "We just can't stand that you're not still taking care of us. What if we set you up with a little clinic somewhere and you could bring people in?" So now I have a little clinic on the north side, and have about 50 or 52, depends on the day, patients that I work for and with. So
yeah,
that's
so
about it.
I mean, I think one of the first things right out of the gate, since you're both sitting in the same room, is the differences on how standard medical practices are set up, which there's fewer and fewer independent people
Yes.
like yourself, which I think is a real problem. And I think it's something where I'm gonna call you doctor. Dave doesn't like me
He
called
is a
doctor.
doctor.
I know, but he doesn't like it. So I'm gonna call him Dave, but he is a doctor. So, dentists are set up much more independently, just structured independently. So, it's interesting to me to see how most dentists kind of have responded since COVID, and how they've talked more openly, and kind of what they're held to as far as standards versus what doctors, not just independent doctors, but then doctors that are within, here locally, we've got 2 major medical institutions, systems, and, other cities have 1 or multiple, but
5, yeah.
the real problem I think that we're kind of narrowing down to here at the end of April is me and Doc have been trying to figure out, okay, what captured the medical system, why, what happened with standard of care where, Dr. Roy and other people couldn't try to treat people with COVID early on with the things that they were hearing was working elsewhere. At some point, something took over, and that's what really confused and concerned everyone. And before we started, Dave and I were talking about that because we hadn't talked about COVID in our previous meeting. And so maybe we kind of rehash kind of what that is, because we've talked in depth with what happened to Dr. Roy. I mean, he had an independent practice, so he was an independent thinker and doing things more the way he wanted. But the problem that he had was if someone would come to him and need something and he would try to refer them out, the local medical systems wouldn't take his patients unless he and his staff was vaccinated. Mm-hmm. So basically basically they tried to kill his practice, or threatened to kill his practice if he didn't do that. So that obviously raised a red flag and torqued him off at a lot of levels.
And it was not just one; it was both of the large systems. So you and your staff must be vaccinated for COVID.
Yeah. So maybe just right off of that, I know you have in dentistry you have different boards, and it's not the same ones that Doc Roy has. Kind of lay out what happened at the beginning of COVID. I mean, maybe we can revisit what we talked about earlier. And
sure. Well, we didn't have, as I remember, really the authority coming in saying, okay, you really had to be vaccinated. But it was early enough in COVID that we were still very unsure of where this was going. And, when it hit and hit hard the way that it did at the very beginning, and the news that was coming out that was that the news media was giving us was, people were dropping dead left and right. And, we as dentists were in probably one of the worst positions of providing care that you could imagine. As I mentioned before we started, I mean, my days putting a drill that spins at about 300,000 RPM in a pool of spit and blood and hitting the rheostat. And you can imagine, I mean, it's just a plume of plume of virus. And, whether you had an N95 or you had a face mask on or, whatever, when we're talking about stopping a virus, that's not going to happen. And
so a dentist even knew that? I can't believe that.
You can't believe that. Well, when we wear a mask, not speaking of COVID, I mean, we're not talking about stopping viruses. That was something that, you just thought if you had a virus, we'll get a cold from it. Mm-hmm. We're weeding out the large particulate that splatters up. That's the idea of wearing a mask. We're not really wearing a mask to keep the patient from being sick or from us from getting sick. We were just weeding out the large splatter, for lack of better terms, as to what was going on. So, even not being physicians, I mean, we had a pretty good understanding that, we weren't going to stop a virus by wearing an N95 mask or whatever, shield or whatever that we had.
Right.
So with the information that we were getting, and as severe as the outcome was for supposed healthy people, we were just all kind of in a shell-shocked state of mind, thinking that somebody in this office probably is not going to be here in a few months. Mm-hmm. We didn't say that out loud, but we were all thinking the same thing, just because there was no other logical outcome for it.
Well, I think most of society was right there with you there in the very early stages.
Oh, absolutely. And so, when the vaccine became available, I think most of the pressure was coming from probably patients. As I said, they come in, they'd want to show you your card, look what I got. And, you kind of, we probably really, I think all of us wanted to get the vaccine at the time because we were, again, in a field that was, highly susceptible to getting the virus. And as I mentioned, I had some friends at the state level, and I was calling them pretty much on a nightly basis, waiting to get the death toll of dentists and hygienists and assistants. And, there was nothing, the first week, there was, second week went on, and it's just like, well, where are all these, if anybody's going to die from this, it's going to be us. And, we kind of got to the point that it's like, we kind of started to realize that, I don't think this is going to happen the way that they're...
So about what was the timeline on that?
Oh, gosh.
As far as...
We're talking 5 years ago now.
Just 3 months...
Yeah, from about the time that, because it took a little while for the vaccine to come on, but it was still fairly early on, which again, you kind of wonder, gosh, how did all this come about so quick?
Yeah.
But
vaccine was available about February of 2021.
Yeah. So, did you decide as a practice to shut down for a period of time? I know
we were told to shut down.
Okay. How long?
Now that didn't mean that we were shut down, because we were there still pretty much every day treating what needed to be treated. But
right. Like emergency
type things. Yeah. But we did shut down the hygiene center. Anything that could be pushed back was pushed back a bit.
Mm-hmm. Limiting exposure as much as possible.
Yeah, but as it went on and we kind of started to get a little bit better idea of what the outcome of this really was, we started letting the ball roll a little faster as far as what we were actually treating, and the staff was becoming more comfortable coming back in, and so I think we were technically shut down for I was trying to remember, a month or so.
Okay.
But like I say, we were there every day.
Okay. Yeah, so I mean, there's a lot of different directions we could go right here. Again, the interesting piece to me is the people at the higher levels in the state of Indiana didn't tell you have to get vaccinated to treat people, or how did that come out?
I don't recall that we had an ultimatum, but we weren't going to be seeing any patients come through our door if we were at that point in time not vaccinated.
Okay.
And like I say, I think we, for the most part, wanted to be vaccinated at that point. You know, by the time the second one came around, I think we were all kind of, I don't know about this.
Yeah, we were told it was safe and effective, and once you got it, you weren't going to get it, and you weren't going to spread it.
Right.
And then
Doc's trying to spread it over there.
that didn't quite happen. So I mean, it's just, again, this interesting. The two different institutions, from a medical to dentist, just both in the state of Indiana, and just how they responded is interesting to me.
Yeah.
One of the things that's most, I don't think interesting is not the right word, but the fact that the institutions really haven't resolved the issue in any sense. They haven't come out and said anything about, hey, we really didn't do that very well, or we can do a lot better than we did the last time, and here's what went wrong, and here's where there's been no admission, there's been no acknowledgement. They're still pushing mRNA vaccines, which is what me and Dr. Roy talk about, and we're probably got a couple clips in here we're going to hit on today, and it's just because if I'm here to do anything, it's to prevent someone from being harmed, just like you're. I mean, I don't know how that works in the dental realm. I mean, you obviously don't go in to harm people. You're going to fix their mouth. Different aspect. It's not. Is it a Hippocratic oath? I mean, you do a similar thing. Is it not exactly?
It's similar, but it's a different level of care that we're doing.
Yeah.
Well, one of the things that I really didn't like at all was that we had everybody except one in our office got COVID, and we had virtually to close down for 2 weeks because of that. The lady at the front desk, 2 nurses, and me all got COVID at the same time because one lady felt a little bad and came to work and spread it to all of us. There was only one nurse who wasn't exposed, and she kept the place going. She would not treat patients, but she would, if they came in, she would buzz me and tell me to do a visual thing with them. So I did that. But then after that, we all had high immune titers against that. In fact, one person went over and tried to donate her plasma, and they said, no, we got enough. And then when the vaccinations came out, they were right up front. They said, everybody in your office and you are required to take this if you want to use any of our services, because we will cancel you. So I didn't know. I took those, and a lot of other people did. But a lot of my patients didn't. And we were not turning anybody away for not taking the things. But I've got patients now who have had 4 or 5 COVID shots and boosters who've had COVID 4 or 5 times. And then there are other people who didn't get vaccinated who haven't had it at all.
Do you remember how vilified we were for not taking the vaccine?
Oh, yeah.
Oh, we showed that video on last.
Yeah, we showed a clip last time.
Just how vilified, like we were bringing down the world. We're killing Grandpa, man.
Have you noticed, Doc Roy, the severity of cases? You already mentioned one signal that people that aren't vaccinated tend to not be getting it more. Do you think the ones that are getting it, is it getting worse or is it getting weaker over time? What do you...
I think it's getting weaker over time. Now, I'm not seeing near as many patients as I did back in 21 and 22, and we closed at the beginning of 23. But you know, a lot of those cases that I saw during that period of time were very mild. People would stay at home for 4 or 5 days, and then they'd feel better and come back to work. So, don't know.
Yeah. So, I'm trying to think of which would be the best way to go. I mean, at the end of the day, I think the medical system. Me and Dave were talking about it before we started. He's like, I don't know how we're going to fix it. And we got on a little riff about talking about what Doge is doing and people criticizing it because it's taking a wrecking ball versus, taking a fine precision cutting. And I think the more we see, how do you do that in a fine tuned way? You can't. I mean, you can't. We're the biggest thing that Dave and I kind of came to is like we hope that Bondi starts arresting people here before too long.
Well, they've arrested judges already.
Yeah, that's starting. The thing that Elon hit on during the Rogan podcast, where he was talking about how senators like AOC come in worth nothing. That was a bartender. Now she's worth $20 million or something dollars. I mean, how does that happen? That doesn't happen on a $200,000 or less salary. You can't put enough into stock market to make that amount of money. There is no way.
Compound interest.
There is no way. They could have been early investors in Bitcoin and still not have made that amount of money. But at the end of the day, I mean, we're trying to figure out a way to root out the corruption that's built into the medical establishment. And that's the only way I think we're going to get trust back.
Well, one of the things that I just saw today is that the FBI is investigating several of the large how can I say it? The large publications from the military or from the medical group. Chest was one of them. New England was one, and there was another one that they're investigating because they were saying the wrong things. Basically, that you must do this, you must do that, all of those kinds of things. The one that bothered me the most was Chest because at one time I read that religiously every month when it came out because it's all about what I do, lung disease.
Well, I mean, I think structurally we know that pharma funds medical schools in a large way. And last I checked, I don't think pharma's cured one disease. Right?
No.
And so,
well, antibiotics might have cured a few. I mean, strep throats.
Right. Well, I mean, yeah. So, I mean, those are like the oldest things on the market, and we, that's not anything really new that's been developed. But at the end of the day, I think personally we need a system, and I don't know how you rework it, but a system that's built on outcome based rather than financial incentive based. I mean, I know a lot of people go in to be a doctor or dentist because it's you have to be smart. There's a financial aspect to it. You're going to, do good work and have a good living. And no one, I mean, you guys put yourself through a lot of debt to become the positions that you are. But, at some point, if we're driving doctors to go spend $300,000 plus to become a doctor, and they can't make the money that they want to make, then they're not going to do it anymore. And that's not very good. So, I mean, I feel like somehow if we can get a system built around positive outcomes rather just handing a pill and it being kind of band-aided, let's do the root cause solutions, which is what you and I have talked about. And that's kind of along the lines from the holistic dentistry portion that me and Dr. Roy get a little bit of friction on some things from a holistic medicine versus standard medicine or traditional medicine. But even what he calls woo today is like some of the things that you practice even today.
What I called it 5 years ago was woo, and now it's what I do.
So that's really interesting to hear you say that. You've never quite said it like that.
Yeah.
So you say woo a little bit, and you're kind of making fun of it, but at the same time, it's like, well, now it's just it used to be like a big deal for you to say give someone a vitamin D supplement.
Yeah.
Like that was you just don't do that, or get out in the sunshine. Like these are things naturally we should be doing, and there should be incentive for. But I guess maybe I don't know which direction. Travis, do you have anything that you're curious about yet that we've talked about? Any questions for either of the guys?
Not at the moment.
Not at the moment. Okay.
Yeah.
I'm going to go into a couple clips here.
Well, before you do that, I wanted to talk a little bit about. I think my brain turned in about April of 2021, despite the fact that the immunizations were out, and despite the fact that there were getting fewer and fewer people in the hospital. That's when I ran into the use of old drugs to treat COVID, in particular hydroxychloroquine and ivermectin. Mm-hmm. That the one guy that I looked at his results and I said, I just got to start doing this. He had treated 9,000 people in Marseille, France, for COVID with ivermectin, and had a very, very good outcome. And I started doing it about April of 2021. And in the period of time from then till now, I have treated over 150 people with ivermectin, and none of them have had to be hospitalized, and none of them have passed away.
What condition are they in to go to a drug like that? Not just probably not feeling well.
Yeah,
they're probably more advanced.
They're not feeling well, and they're having problems with it. And I guess, I don't know how he decided to use that, but he did. And, obviously the guys who were taking care of people in the hospitals were not using ivermectin, but now they're using it in the hospitals, at least some of them, and they kind of had to go out and feel around, say, well, what'll happen if we do this? And they gave him plasma, and that worked pretty well, but it was highly expensive to make sure that he had plasma that didn't have, like hepatitis or HIV in it. And then as they moved on a little more, they said, well, let's use steroids. And they used steroids, and not just all steroids, but they used one particular one, and that had good outcomes, better outcomes than people who didn't have the steroids.
Did you ever get to do any monoclonal antibodies?
No.
Okay. There was some of that around here. I heard a few people, but then it went away.
Yeah, the reason it went away was that at the beginning, a lot of people were wanting to donate their plasma for monoclonal antibodies, and I had one patient who did that because we discovered very early that she had immune bodies for that, and she donated. And then the reason they stopped doing it was that it's very expensive to keep that stuff around, and it's very expensive to test every bit of it to make sure that it doesn't have hepatitis or HIV in it. Also, Pfizer came out with a drug to quote, kill COVID, and they obviously wanted to use that one rather than monoclonal antibodies. So,
yeah, Dave, we've gone round and round on ivermectin. Almost every episode we talk about it. And
I even got some right here.
Dr. Roy sells it.
You want some? I'll give it to you.
And, one of the early on when he and I started talking, just hearing how anyone that even used that word was just made fun of. I mean,
Oh, yeah.
we talked
Horse
about
paste,
horse paste. I don't know, it was CNN or one of those news
worm
organizations
stuff.
made fun of Joe Rogan and made the tint on the camera green to make him look green because he was taking horse dewormer. I mean, there was just such a media campaign that, to me, we were already questioning things, but it just reiterated to me just how captured the media institutions are, and how we can't rely on them to give us truth. I mean, even here locally, who I think no ill of any of the news reporters around here. I know people that own stations, and I think they're great people, but they have clear narratives that they can't even talk about. And to me, it's some of the most important thing. I mean, two things we should be talking about right now are RNA, mRNA vaccination protocols and ethics, and AI ethics. We should be talking about how that's going to affect society all around us. They should be having nightly conversations about it. I mean, if Travis would show up every night, we could sit here and fill 2 hours every night talking about how things are going to be changing. But at the end of the day, we're here doing it because they're not. And so, like, part of this roundtable here is, what are we going to do? We need smart people in a room to try to figure these things out and raise red flags when we see them.
Well, there was obviously, a very well orchestrated narrative that was being funneled, because they were all saying the same thing.
Yeah.
And, that's
all around the globe.
All around the globe.
When have we ever agreed about that?
And that's obviously not going to happen. They were reading from a sheet, and I mean, you can see any number of the YouTube clips of, 10 different narratives all being read word for word from people that don't know each other. Mm-hmm. And so, you'd think that would be a pretty easy thing to trace back and to understand where that was being born from and how that was being delivered. But apparently it stayed under wraps pretty well.
Mm-hmm.
Well, I mean, part of this, adding you to the fold of this regular conversation, we've invited countless other doctors on. It's an open invitation for other doctors that want to come in and have a conversation. I guess, to me, part of it is gaining some trust back in that, but also trying to figure out, me and Dr. Roy talk about golden duct tape and golden handcuffs a lot in his profession, in a sense that if a doctor today still mentions the word ivermectin, I think their board above them are probably looking at them with leered eyes, like, careful. And it's like, it helped people more than the vaccine has helped people. The vaccine, anyone with an open mind that just goes out and look at data can go to any number of channels and say the vaccine's actually doing much more harm than good now. So why aren't we reverting back to the things that we know at least worked? We haven't talked about getting more higher vitamin D levels at any large capacity. Get outside, get our kids outside. Let's not keep them in school. What did they do whenever they locked them down, put them inside with masks, separated
the whole thing
them?
that Fauci said is stay inside. No, get outside.
It was the polar opposite.
Clean.
It was the polar opposite of what we should have been doing.
And they knew the vitamin D was beneficial early on, because that was being discussed in the media, where there was at least a little bit of wiggle room to talk about alternatives, or not necessarily alternatives, but things that you should be doing. Mm-hmm. And, when you can't go out by yourself in a kayak in Michigan, people were saying, but, having vitamin D would be, very optimal. So they knew that. I mean, that didn't come late on going, gosh, vitamin D could have helped. I mean, they knew that.
For me, it happened. The bell that went off that I'll never forget is we were told not to travel, not to leave the state. Florida was not allowing people that didn't own property in the state. And we had, I think, spring break plans. And most of the Airbnbs and all that, basically, we were just canceling all the things. And we got a rebel in our group, whoever we got the VRBO from or whatever. And he's like, nope, if you want to come, I'm not going to tell you can't come. So we went there against orders. And I was listening. I was already heavy into listening to the podcast because all my tyranny bells were going off. And I remember going outside to the beach and listening to a podcast to them saying, being out on the beach, you shouldn't be out on the beach because it's not safe. and here you have the ocean breeze blowing from the east, from however the next island you're going to have there. Like, if I get sick being out in the sunshine on the beach with the breeze blowing in my face, then why are we even hiding?
Yeah,
because there's no escaping whatever's happening now. So it was just such a blatant lie. And this is a conspiracy theory. It was like, seemed to me like it was just a mind control experiment. Like, what could they actually get away with?
Absolutely. How bad could they make it?
I to this day I still don't understand that. And like, mainstream psychologists aren't talking about it. Like, early on, I was like, we're going to shut down schools. What kind of damage is that going to do just to the kids' development? You can't undo that at those ages. There's no undoing the missing that happened there, and the mental torture that they went through with the masking and the separation and the development and the touching. And I mean, we've created a ripple in time that I don't think we'll ever get back again. But the lesson still isn't learned. People still aren't. I mean, I think people on the inside really do feel it, like, yeah, I'm probably not going to fall for anything like that again. But like, we need something that we can all go to and say, hell no. Like, we're going to listen to other people. You're no longer in the fray. Like, that clip that we showed with all the news anchors and whatever.
I was saying the same thing.
A lot of those people are still in the business.
Oh yeah.
And a lot of people still turn on those channels, and I'm like,
They're
no
talking
repercussions.
heads. They read what's put in front of them. They don't have any journalism.
Well, I mean, I think it's worse than that. They read what's in front of them, but they're also captured by the people that pay their checks.
Sure.
And so it's just, that's the reason, part of the reason why podcasting has gone through the roof, because, I'm trying to do something a little different than everybody else, just because I'm trying to look through all these different things that I'm seeing every day that people don't normally have time to, and kind of condense it all into one segment, just to, our viewership's going up, and I'm thankful for that. But at the end of the day, I'm not doing it for that. I'm doing it because there's nothing out there that I can go to and trust. So I feel like I got to pay attention to the same people that were ringing the bell early on, the Pierre Coreys, the Robert Malones, the Peter McCulloughs, all these people that are saying something's not right here, something right. And all I'm doing is just adding more people. Like, there's Dr. John Campbell. We're watching a lot of clips from him. There's all these different guys and gals, and the story's being told, but the media still is putting a dividing line. Like, it's turned into a Republican and Democrat thing versus health or not health.
I sent you actually a small clip about that. Did you see where the media said that at the Pope's funeral, everybody was asked to wear black, and all it did was it zoomed in to show 10 people around Trump were wearing black and Trump was wearing blue.
Yeah, I think I
But then but then if you see the actual picture, half of the crowd was in blue, and then half the crowd was in black. But they needed to cut it just right to make Trump to be the evil devil, who didn't listen, who's not doing what he's supposed to be doing for the Pope's funeral. Anyway, you're just talking about media being skewed and whatever. I mean, anyway, yeah.
It's unreal. I thought I had that queued up here. If either one of you guys got something to say on that, feel free to dig in that.
That's that guy right there.
This one?
I believe it was that guy.
Let me pop it up here.
Yeah, that's it. You ready?
Yeah.
Does to get people to hate Trump. The Vatican asked Pope Francis' funeral attendees to wear all black. Trump wore a blue suit. So that's what the media says, and this is the image they show you, right? Now here's a picture with more context, and you can see how many other people were dressed. I'm zooming in a little bit more so you can see it. There's a lot more blue than what the media was trying to lead people to believe. Again, this is the image they showed us, and this was the reality. And this is a perfect example of why the trust in the traditional media is at an all-time low. Like, they had to zoom in and get the perfect situation to push their narrative. And again, it's not about being intellectually honest or even fair. It's about pushing a narrative. And this is a perfect example of that. And it's beautiful to see the American people picking up on that and not trusting these traditional media outlets. Clearly, he was not the only person wearing blue there, but the media wants you to believe something else. This here is a perfect...
Yeah, so, I mean, it's a this is not somebody traditionally that I would have looked at, but I mean, these types of things are popping up in my feed all the time now because I'm listening and paying attention to people that are calling out lies fast. I mean, so to me, that mechanism of recognizing, okay, this person's told me the truth multiple times and they've said things that no one else was saying, so I need to pay attention. But, most people don't have time for that.
Right.
And so, for me, like every day that we still have an mRNA vaccine and or mRNA COVID shot going into a human, and especially now they're pushing it on children, I'm actually angry. At some level, I'm just angered by it. I don't understand. This is the one failure to me that RFK is not taken as deeply and as fast as I would have liked. Dr. Roy has an idea as to why that is. We talked about it pretty in depth last week, but it's like, so people like this, people like me, people like you guys that are just like, something's not right. So, if this mRNA vaccine is not going to save my life, then why am I going to put it in my body?
Yep.
And there's no proof that it's going to save anybody's life right now. So that should be on full stop as far as I'm concerned. That's just my opinion. That was a good clip. Thanks, Travis.
I do what I can. I can't do much, but when I can, I try.
Is he a regular podcaster?
Who, me? Oh, that guy.
No, I've never.
Once again, it was kind of like Chad said. There was something came across my feed, and it was talking about not trusting the media. I'm like, hey, that sounds like me. Let's see what.
I haven't seen him before. I pay a lot of attention, so I'm going to keep my eye open. I'm going to keep my eye open.
I mean, it seemed like he had some equipment around. I think more and more, avenues like what you're doing and what this gentleman did, I think is a good thing, because if it can call out the media discrepancies and false narratives as they're happening, it's going to get harder and harder to have that take hold like it did in the past.
Mm-hmm. Agreed.
That's
why we're here. Right?
I got another clip. Exactly right. And I got another clip here that's on the mRNA. So this Dr. Patrick Soon-Shiong, I think I'm pronouncing that close to correct. He was on Tucker. It was an awesome interview he did on Tucker. This is actually a little shorter clip on Dr. Drew, and I think it was relevant to our conversation.
A vaccine that does not clear the virus. That is
not only that, Patrick. Why did we create a vaccine that reproduces the most pathogenic component of the virus? Why not the nucleocapsid? Why not the whole virus? Why do we keep pushing on spike? It's insane.
Oh my God! You're singing my tune exactly. I've been saying this since 2020. Think about this. I'm not only worried about long COVID, I think I understand why we're getting long COVID. Your idea about spike, this thing called spikyopathy, the idea that the spike could come either from the vaccine or from the COVID virus itself. And if it comes from the vaccine, does it break off and does it actually replicate? If it replicates, does it persist? If it persists and replicates in a certain part of the tissue, does it reduce what they call P53? Is it then a harbinger of cancer? Is it going to act like hepatitis and HPV, God forbid, where in fact 5 years or 10 years from now, is it potentially the explanation why I'm seeing 8-year-old, 10-year-old, 11-year-olds with colon cancer? Mm-hmm. Why did we create a vaccine?
Was that it? Okay.
That was it.
So that's basically reaffirming what we just talked about. And here's the thing. The reason why, to me, that's a relevant clip to share is people still are getting the vaccine. People are injured. People are having long COVID symptoms. People have myocarditis, turbo cancers. So there is...
Dropping dead at football practice.
Yeah. So there is, I think, a need for the public to be aware of an underlying issue that's going on. There's, I think Dr. Roy said it in a way that when he said it, it kind of took me back a little bit. I've never heard him say like that. He said, and he had fear in his eyes when he said it. I don't know how long ago it was. It's been over a year. Basically, he said he felt he had a ticking time bomb going on in him because he was forced to vaccinate. So there's, the spike proteins that they're talking about. So this guy here, why I'm paying attention to him is he was basically, I think he's on the path to a cure of clearing the virus in total. And when I say virus, it's spike proteins, anything that was left over from the mRNA vaccine. But he's had a lot of people trying to cancel him. They tried to buy his technology, and he had made billions on a prior thing, so he just opened his own lab and he's doing his own thing. So anyone that just wants to follow him, you'll find him all over the place. That Tucker interview is definitely worth a watch.
Yeah.
If you have the time for it. Okay, so we can slide. There's a bunch of different topics. We didn't come just with a bunch of medical stuff. There's a lot of good questions that are going on. We've talked about autism a lot. And, you know, there's conversations going on. Is autism vaccine related or not vaccine related? Ultimately, I don't care at the end of the day. If it's not that, it's definitely something that's going on. It's going up. I'm paying attention really heavily to something Dr. Jack Cruz said to us. I'm doing some research into EMFs and Wi-Fi and all the things that potentially that could be impacting exposure and the diseases that we're seeing at the levels that we're seeing them.
Being in the tech sector.
Got my ENF killer right here.
That's right.
Being kind of in the tech sector for as long as I have, I've always wondered, even when wireless technology was kind of first taken off back when I was probably in high school, when, you know, Wi-Fi was kind of happening, and then as Bluetooth came along, and then you've got radio waves, and you've got UHF and VHF, all these waves flying through the air. I'm like, there's got to be something wrong with that. Like, there's somebody, I don't know what, but something's got to be. And if you do any research, a lot of things try to act like it's not a problem, but there's a lot of waves in different frequencies, different hertz, megahertz, and gigahertz that are flying through the air. So I don't know.
It all got a lot of hertz in it.
It hurts.
It doesn't sound good.
Oh, man, it's so much pain. It hurts. That was terrible. That was awful. You must be a dad.
So I ironically just got on a podcast today that I hadn't finished, and I don't have the clips, I don't think, perfectly cleaned up. Might have one in here, but it's Danny Jones' podcast. I thought I had. Yeah, I do have it. I've got one in here. This is talking about EMFs a little bit, and this is jumping around a little bit, so I apologize if it's not really matching up to what we've been talking about. But at the end of the day, for me, we have to figure out what's going on with our health, and the way they are villainizing RFK and the way they've tried to keep him out. Obviously, to me, it's obvious to me. I don't know if it's truthful or not, but it seems obvious to me that the people that benefit from our illness and our industries that basically I don't. The thing that this guy talks about, he goes really deep into the Wi-Fi and the 5G and all that stuff. There's another guy that Travis, I think you would be interested in watching it, and maybe we can tag team it. Is the direct energy weapon technology and stuff that they've got going on. Mm-hmm. There's a really interesting podcast. I think it was with Tucker. You would have known that probably if there was. I'll share that. Let's not get into the weeds with that one just yet. Let's talk about EMFs for a second.
I brought some portable incandescent lights because I wasn't satisfied with the lighting environment. I do that when I travel. It's great because incandescent lights, my opinion, healthiest lights.
Obama banned those, right?
Yeah, they've been on the chopping block for a while now, so they're banned from manufacturing in the United States. There's a 45 lumen per watt efficiency standard by the Department of Energy. Mm-hmm. So that is measuring the amount of brightness versus the amount of power that's required to power the bulbs. The
Department of Energy?
Yeah. And that's
the same company that was renamed 3 times after it was originally called the Manhattan Project.
Sure. Yeah.
The company that made the fucking atomic bomb.
Department of Energy. Yeah. Okay.
That's crazy.
I didn't know that. But the problem is they have a standard that is completely ignorant of the fact that infrared light is vitally important for our biology and our health and all life on this planet. Sunlight is 50 to 55% infrared light from an energy perspective, 70% infrared light from a photons per second perspective. And when we switch to LEDs, that goes to 0. When we're inside behind energy efficient glass, a lot of that gets filtered out. So what I like to do with incandescence, and Steve is pulling up some nice spectrums here.
Yeah, this is what you were showing me at the house a minute ago.
Yeah, we measured it with the spectrometer. It's rich in long wavelength low energy light that is very, very beneficial for our biology. It does things like stimulates melatonin production in the mitochondria to actually balance the oxidative response from higher energy wavelengths, such as blue, violet, and UV. And we're deficient in infrared light. So the incandescents put that back. So I'm a much bigger fan of incandescent infrared maxing as opposed to blocking blue light during the day.
Yeah.
And
So you were just at my house and you gave me a new incandescent bulb for one of my lamps, and when you first scanned the lamp with the LED bulb, it looked exactly like the one on the left with that huge blue spike. Then when he did it with the incandescent bulb, it looked exactly like the one on the right. And we went outside in the sunlight, it looked more like the incandescent chart on the right.
Well, it looked like the one on the left here that's showing the sunlight, which is full spectrum. So you get a lot of, violet, you get ultraviolet, you get everything. You get everything from ultraviolet to infrared. And these spectrometer images don't even capture most of the infrared spectrum. The infrared spectrum goes from like 750 nanometers to tens of micrometers. Like it's very vast, and the visible spectrum is very narrow. It's like 300 nanometers. So the majority of what you're taking in from sunlight is infrared. There you go.
Steve, if we lit our studio with these incandescent lights, what would be the downside?
It would cost more money.
Yeah, so I mean, I've lit tons of studios.
Power.
It just takes like thousands of watts. Like, so if I were to use, for the key light back there, I'd probably use a 2K or a couple 1Ks, like minimum. I'd probably do probably a 2K or maybe 4,000
And they get really
watts.
hot, right?
Yeah, that is the infrared light. It's not as great down here in Florida, but in Wyoming, when it's too cold for me to work outside or it's like snowing or something, I have a 250 watt chicken lamp, which is just a 250 watt incandescent bulb next to my indoor work setup, and I just blast that on me all day long. It makes such a difference.
Really?
Yeah, and you want to talk about red light therapy? Well, we were talking that a little bit about your house, the red LEDs and the red light panels. Those are great, sure, photobiomodulation, but they're like 2 wavelengths or 3 maybe, whereas sun is all of the wavelengths in the visible, so many wavelengths in the infrared. So I'm a big fan of broad spectrum light. And
Jack was in here. He was like, "You guys are f***ing up. You need to take the roof off this building. Open up that wall. You guys are f***ing blowing it."
You could just open the windows.
There's no windows in here.
Oh,
we're in a spaceship. Have you noticed?
Yeah, I did notice.
All right, that's good.
Yeah.
So that kind of touches back. So I mean, I feel like our health.
That's why we go to saunas 2-3 times a week, is to get infrared light.
That's right. Well, that's got the chicken. I got 2 chicken lamp lights in here too. That the thing is, it does get hot in here. So that, like this time of the year,
Does it fry the chicken for you?
I don't have any chickens in here with me. It might be frying Dave if I turn it on. Dave the goose might be cooked over there before it's all said and done.
There's nothing but, inside stuff.
So I did watch a little bit. I'll have more clips to this podcast probably later. This is something me and Travis have been digging into, and I just watched the beginning of this today. The interesting thing that I did want to bring as a signal to people that are interested in light. Obviously, Dr. Roy is wearing his blue light blockers, which typically I don't do until the sun goes down. That way your melatonin, according pathway, and your melatonin starts producing. Once you do that, I notice a huge difference in people. My wife makes fun of me. People make fun of me. I really don't give a shit. But I feel
your wife doesn't make fun of you because of the glasses.
Yeah, whatever. I got clips on that for later. But for me, after the sun goes down, especially if we go out, one of the things we do is like we'll go out to lunch or something. If I'm sitting under an LED light now, I have to either unscrew it or have these on because it just hurts my eyes. Yeah. So first of all, I've taken all the LED lights out of the house. These are LED, but they've got a orange film on them. If I can get better lights, I will. But I highly recommend everybody to resist what's happening. I didn't get the clip on it, but what's coming from our government, I think it's DOD. They're actually wanting to clamp down even more stringently on the efficiency of the bulbs that we have to use. So they're trying to restrict the amount of power that we're using because of quote unquote global warming. However, there is no counter argument from a health perspective going on about how are these lights actually affecting us? And it's one of the reasons why he and I have tried to engage with Dr. Jack Cruz a lot. It's because he has, from the beginning of this whole campaign, said light is more important than the food. So he's kind of made fun of the Maha movement and with RFK, because he and RFK met early. He and RFK hasn't talked really about light, even though some of his underlings do. Like, who's the guy? Gary Brecka's kind of going around all over. He always talks about getting out in sunlight and grounding, getting your feet on the earth, and getting outside as much as possible. So there is the conversation going on, but it's not at the level. He wants to talk about technically in the quantum physics and lights, the EMFs. He believes from the damage that it's doing to our body that it's much greater than what the food is doing. I think all the stuff that RFK is doing with food is great. We do have some clips here that we're going to share, but it's not the whole story. So I just, this whole thing with the DOD trying to clamp down on and even more control the lights is concerning to me, because one of the first executive orders that Trump did when he came in was to basically re-legalize incandescent light bulbs. The thing is, we don't have anybody manufacturing right now, right? And so we got that issue going on. But I don't know if anybody had anything to say on that. Sorry.
Probably bringing in the old geezers who know how to run the machines to do that.
The old geezers to run the machine?
Yeah, like me, to run the machines to build the old incandescent lights.
Did you ever hear about some of the first incandescent light bulbs? They actually lasted for a very long time, and they manipulated it and changed it because nobody would have to buy new. I mean, you'd have to buy new ones, but not near as often.
There was one light bulb that was in the back part of a theater in New York City, and it was permanently lit for 24 hours a day for over 30 years and never went out. Somebody finally, it died or something like that. 30 years for a light bulb, that's amazing.
Yeah. I think the on-off-on portion of a light bulb diminishes its life. That's probably more of...
I had a fraternity brother who was a electrical engineer, and he said it takes more electricity to turn on fluorescent lights than it does to run them for 8 hours, just to turn them on.
Trying to get the ballast going and everything. There you go.
Well, I got some humor clips. I'm trying to think if I want to throw something in there. It's very distracting. I'll throw something in very distracting.
Sure that's not going to get us thrown out again?
It's definitely going to offend some people.
Well, now I edited last week so that we can get it put back on. So if that happens this time again, I'll just
we didn't get taken off last week because we offended people.
It was just a copyright thing with the music with good music for our people to listen to.
So
anyway,
most people, neither one of the docs talked about this whenever they first sat down, but both of our docs are very high 2A supporters, Second Amendment supporters, and so when I saw this clip and I knew you guys were coming in, I had to share it.
Yes.
Finally. That was good. I like that.
Yeah, that one's been floating around a while.
Have you seen that one?
Yes,
it's probably been Doc's a little disadvantaged today because he's usually got the catbird seat on, watching himself on the camera, but he can't see it.
Yeah,
I might be able to turn a little bit here.
Well, I think maybe when we have both docs back in, we can maybe arrange. I can put maybe my monitor over here, and we can maybe screencast mine onto two different things.
As long as I don't take out the bourbon, that's all I'm worried about.
No. We got another bourbon supporter here.
Don't spill the Buffalo Trace. Since they've flooded, that's probably a pretty expensive bourbon now.
Yeah. Well, but they really didn't get too much. I was actually watching a thing specifically about Buffalo Trace. They did have to stop shipments for like a week or two or whatever, but nothing really got damaged, and they were able to put production back on. They just couldn't ship for a while because nobody could get in and out to them.
Yeah. Their barreled parts were probably fine, but everything that was in production, it was an issue.
I don't know, Doc, can you see that at all, bud?
Yeah, that's fine
all right.
there.
There we go.
You can make sure that he still looks as handsome as he did whenever we first started.
Right.
Get out one of like a comb, just kind of slick back the hair.
I know.
That was kind of the joke.
I've been missing my hair since I was 20.
Remember the old, like the switchblade combs? Remember those things? Sorry. Anyway.
Yeah, we watched Grease last night. So that was on one of the, and that's what whip them out and
yeah, exactly.
We'd have to go down to the novelty shop on, I think it was Main Street would sell those.
Nick Knackery probably has them or something.
Yeah, I can't remember the name of that one.
but not nearly as good as the old ones.
No,
the old ones used to be. They were made right. It's a switchblade comb, and you really could use it as a weapon if you wanted to.
Have a switchblade comb and a candy cigarette, and you're ready to go, or something like that.
That's right.
I remember the candy cigarettes. Yeah.
Oh yeah.
Oh hell.
Well, there's a better. So there's another series of clips here that I want to talk about. This is kind of a new group that are kind of doing something similar that I'm trying to do, and so I'm not trying to reproduce what anybody wants to do. So I'm just going to kind of prop these people up for doing what they're doing, because it saves me work. I don't have really all the time in the day to have my other job going and trying to build a podcast, but they're kind of doing similar things. So I think if there's enough people kind of pooling together and bringing this information together, to be helpful. So there's going to be a series of clips here. I'd love both docs to weigh in on it. It just so happens, I think this first clip might be a little bit of an ivermectin plug. One of the ways you can support the program is Dr. Roy is selling ivermectin, and he's bought some equipment. I think we're all even on equipment, so hopefully stockpiling more money that we can buy more equipment and not investing Bitcoin without me, and we can
putting it all in Bitcoin. That's for you anyway. There you go.
That's payment for being on the show. We don't have real money, so you get ivermectin.
You get bourbon and ivermectin.
Yeah, there you go.
It's not bad.
What could go wrong now?
Put that in your toolkit. So anyway, this first, I think it's about 4-minute clip, so it's a little bit of a long clip. But this whole podcast with Dr. Pierre Kory, Dr. Pierre is one of the early bell ringers who fought the medical system fighting him. I think he's had them trying to grab his license for a long time. He's gone through to hell and back, honestly, and he just keeps coming back, and I appreciate him for that. But this is a great series of clips, and I want to get your guys' take on them.
60 Minutes did a terrifying report about how bird flu is poised to be the next pandemic. Now, we can't show you 60 Minutes videos from here because they take our videos down when we do. Here is the transcript. Look how scary this is. This is Dr. Angela Rasmussen, an American virologist working in Canada. She said that it's not just the number of human cases of bird flu that's alarming, but that the virus is jumping to more mammals. And it's basically E-I-E-I-O. It's chickens and pigs and raccoons, and she just goes down the list. She says she can't sleep at night and that we need to be actively testing for it and looking for it, or it's going to explode before our very eyes. Bill Whitaker says that if this does, in fact, become the next pandemic, he says it would make COVID look like a walk in the park. Dr. Pierre Kory is the founder of the Leading Edge Clinic and author of The War on Ivermectin, the medicine that saved millions and could have ended the pandemic. He joins us to discuss. So, doctor, how worried are you? Are you able to sleep at night, or are you up counting sheep like this virologist from Canada?
You're asking me. I am not worried at all. I mean, as you guys almost kind of pointed out, I mean, what makes an expert is pattern recognition, right? We've seen this playbook before, right? Instill fear at the same time that you come out with a fast-track approved vaccine, a terrifying vaccine, a self-amplifying mRNA vaccine, for avian flu, and you're trying to create and drive a market to get vaccinated. And, Clayton, I listened to you just a moment ago, and like you, I don't think this playbook works anymore. I mean, their big show was COVID. They've been trying to do it again. I remember our smallpox pandemic that they tried to scare us with, right? That was the whole thing was silly. This one, although I'm a little dismissive, avian flu, if it does jump to humans, which there's no, conclusive evidence that's doing that to any significant degree, it's all potential. That does have a higher mortality rate. That is difficult. But here's the thing. The real reason why I'm not worried, two of them. One, One, we have learned so much about how to treat viruses. I have a dozen therapeutics in my toolbox, which I know would cure avian flu. That's number one. Number two, and this is where it gets absurd, we shouldn't even be talking about avian flu. It could be eradicated today just by treating the water that the chickens drink. There's something called chlorine dioxide, which is at high levels. It can be used as a disinfectant. It's also used as a water purifier, but it's the ultimate biocide. It kills viruses, fungi, bacteria, all pathogens. All you have to do is raise the concentration in their drinking water, and we wouldn't be talking about this. But I'm hard to come up with simple solutions to apparently intractable problems.
It seemed crazy. I mean, watching that 60 Minutes clip, I mean, they really are pushing this agenda. So do you think it seems like it's right out of this playbook where they're trying to get us all scared, and then they're really trying to activate the vaccine manufacturers? Like you mentioned it a second ago. Do you think that that's the playbook here, is really to sort of, all right, we got to fast track billions of dollars in these new vaccines?
I do. I mean, I think I'm seeing that pattern also around this measles, right? I don't know if you guys are aware, but I was involved with children's health events and reviewing the cases of these two supposed measles deaths. They are amplifying that and fear-mongering that. Those children did not die of measles by any stretch of the imagination, but yet they're trying to fear-monger everyone into rushing to get an MMR vaccine. And, maybe I am oversimplifying and drawing rapid conclusions, but where are the cases? Why are they doing a 60 Minutes on it right now? There's no evidence that it's harming us or that it's a true threat to us. But I think it's the beginning steps of that playbook, right? Is to start to foment the fear, bring awareness to it, and then hopefully people be receptive to whatever their newest single solution is that's highly profitable to the vaccine industry. You don't hear about simple, low-cost, available, safe solutions that don't bring profits, and I know of many of them.
All right, that's the first clip. Two things that I take away from it is pattern recognition. Part of what I do for a living is pattern recognition and seeing trends that work and
Me too. Yeah.
And so that's why, but you need pattern recognition, and then you need people with the bandwidth and the reach to say those words to enough people that'll listen. And these things happen so fast, Dave, that the bird flu thing popped up and we started talking about it right out of the gate. And yeah, there were some sick birds around, but all we heard from the media was a one-sided fear campaign versus hearing people like this, that here's some simple solutions that we can just be talking about. So why wouldn't you? It's fine to have the fear campaign, whatever that is, to say this thing's going on, but it also would be super helpful to say, well, it hasn't really shown that it can spread to humans, and here's several things that we can explore to potentially wipe it out pretty quick. That doesn't happen. So they got half of the story right, which is very hypocritical. You don't tell the rest of the story, which is here's how you can get involved if you own a chicken farm or you're concerned about what your chickens might get. Here's some things that you can go do. Why don't you do all of that? So that's why, to me, this kind of stuff is, we build enough reach. We got people that are coming to us because they trust us, and we can share clips and we can riff on it. I don't know. If you have any thoughts on any of that Dr. Pierre just said? Either one of you? Anyone?
Well, I think that's a really good idea. If you've got something that's cheap and easy to do, and kills all the viruses and the fungi and the bacteria, you've got to use that. So
yeah,
just kind of a similar narrative, just repackaged in a different box.
Yeah. So I mean, for me, what I feel like we can't allow is for kind of the medical system to respond in a way that it did, and not just the medical system, whatever. The whole apparatus that basically sent the globe into a spiral and in a instantaneous lockdown. I don't remember this is somebody else's basic concept, but I mean, there's never been anything that all countries agreed with so rapidly than what happened with that. So it was such an effective campaign and communication tool. This is all going back, like we either last podcast or the last few podcasts, we've talked about the fact that the vaccine has come through the Department of Defense. The Department of Defense is synced up with health, public health, and WEF and WHO and all these things, and they're all the information goes to the top. So they've created these mechanisms of hot button, push it, and it creates this whole panic fear campaign that happens rapidly. And so part of it, that sounds significantly like a conspiracy theory. But the fact is, you said it before the cameras came on, we saw it happen. And it was unbelievable. Like you couldn't even really believe what was going on anymore. At some point, you lost trust in everything that was being said. And I don't know what level that has even come back for you or whatever. But I mean, for me, people that watch this are still not trusting things. So we're trying to figure out how to process it and get it back into a realm that we can trust. Got another clip here, same podcast, but again, so part of the thing that they used in this was censorship. Me and Dr. Roy were talking about ivermectin very, very early on when other, it wasn't our idea, but there was early signals. There were people out there that were talking about it. He was hearing it from doctors around the world, doctors in Africa who use ivermectin regularly because of the stuff they've got going on over there. Africans didn't really get affected by COVID in any capacity.
That's how the guy in Marseille picked up on it, was that the amount of COVID in equatorial Africa was nil, and he couldn't figure out why they weren't getting COVID. And the answer was that they're all taking ivermectin to prevent river blindness. River blindness is a disease where tiny little worms get into your bloodstream and get behind the cornea of your eye and make you blind. And ivermectin kills those in a hurry. But to prevent that, they give people ivermectin once or twice a week to prevent them from getting inhabited by the worms. The worms are in the river, and you can't really get rid of that.
So if they're taking it that frequently, I'm assuming that there's not a supply issue with the drug.
No, there was at one point, but they were making it in Africa and passing it out to their people because they could prevent river blindness by giving it to them 1 or 2 times a week. And that's what the doctor in Marseille thought about, and he realized that if they're taking ivermectin and not getting sick from COVID, wouldn't it make sense to treat COVID with ivermectin? And that's how it came to pass. Hydrochloroquine is the same thing. And it's a little more expensive and a little more difficult to take. Some people can't stand it, but ivermectin, I mean, that stuff's like
one of the safest drugs on the market, isn't it?
Yeah,
if not the safest.
Yeah.
No, I don't think there's any known side effects, unless I'm sure you could OD on it if you take all of it, but
well, there's
water,
probably 1 out of 100,000 has
side effect,
adverse effect from it. But what you've got right there is enough for 2 people to take and get rid of COVID right there. So it's five tablets in 5 days, and that's it.
Yeah. On a side note, Dave, and Dr. Roy is not promoting ivermectin for any of the other things that we talk about. And I'm not a doctor. I do pay attention to a lot of them. There's a bunch of different side things that ivermectin is being explored to use. There's a fenbendazole ivermectin combination, along with some other things that they're using to treat some very serious cancers. So we've been researching that just because of the COVID and the spike protein and the turbo cancers and all the different things that are going on. We've been sharing information that other people are sharing just to get more research done, and hopefully the powers that be, the RFKs or whatever, can put some more spotlight on. And another side note, there's a few states that have made ivermectin legal over the counter. So that is coming. I've got a side note. We've got several gals and I think a couple guys that watch the program that do research, and they send me a lot of things. I'm curious, Dr. Roy, and you maybe might not be able to tell me. I would be really interested to know the cancer rates per capita in Africa versus across the globe. And again, just with the ivermectin already being used, and there being some signal that ivermectin potentially is being used to treat cancer successfully, I'm just wondering what the correlation might be there.
Well, I was I knew not very well an African who had come to the United States to learn neurosurgery, and he went back to his practice there and did very well until he died of cancer early. And I think there's probably, they weren't using ivermectin then. That was in the 70s. So it's possible that, and the other thing that makes that hard to figure out is that they don't often, write things down as a cause of death. I mean, and if someone doesn't have access to a hospital, they'll die at home from cancer, and you'll never know about it. You know, Granny went to the Lord, and that's it. So you don't know anything about it. So it is probably as many as there are in the United States, but we just can't pin them down because they don't know. People don't go to hospitals if they can't find one. And I mean, if you live in Nairobi, that's fine. But if you live out in the boonies, that's a problem.
So I know everything on the internet's true.
Oh, yeah.
But this is what I found out with a quick little Google and Grok. Excuse me. So in Africa, the estimated age standardized incident rate for cancer, this was in 2020, was 132 per 100,000 people. So 132 per 100,000. U.S. age adjusted incident rate, 458 per 100,000.
Mm-hmm. So 1/4.
That's a pretty significant signal.
But they don't have, those are not real good figures from Africa.
Maybe not.
Because you don't. Yeah, I mean,
they tried to estimate, so they tried to take that into consideration, I believe. But
I mean, in Nairobi, it may be 100 out of 100,000, but in the boonies, it may be 15 times that.
Couldn't you say the same here, kind of?
But they don't have really any Wi-Fi issues. They're not getting those signals. They don't have the food additive issue. I mean, so they're removing a lot of the stuff that's potentially we're thinking is causing a lot of our problems. So, I mean, I don't know if I would just assume that it's going to be greater out in the boonies because, I mean, maybe it is, but it doesn't seem like to me that we've had cancer at the rates that we've had. I mean, in my lifetime, it seems like it's just been going.
Okay, so how about this? So the EU, they have some different, food, that kind of thing. So the EU says it's a 235 per 100,000. So they're half of what the US is.
Oh yeah, I mean that's part of the reason why RFK landed on the food. I think.
Yeah.
I don't know their connectivity, 5G networks. I don't know how they are there on all that.
Asia is way
worse than us.
way ahead.
EU though. I was talking. This was the EU. So.
But yeah, I mean, you go to South Korea and they're using 6G.
Actually, South Korea. Funny enough, my buddy was at the Air Force Base over there. They actually have countrywide Wi-Fi. So they've got Wi-Fi nodes throughout. You could be walking down the street and be on Wi-Fi because the entire country is blanketed. Puerto Rico, I think, did that too.
It's been that for 15 years.
Yeah. So you can actually, as a citizen.
I have a friend who's from South Korea, and she was talking about that, 15 years ago.
Well, I mean, part of the interesting part of us just sitting around this table and having a conversation is first of all, we're an American. We can have the conversation. We can now say the word ivermectin, and I don't think we'll get kicked off YouTube.
Won't get treated like Joe Rogan did?
Not just yet. My God. I mean, we'll figure out a way to get knocked off YouTube tonight before we're done. But
I'll play some music.
I think this next clip kind of, to me, emphasizes again why we can't allow the same people to censor and to control information, especially as we're feeding large language models. Dave, we've talked about, people are going to ask Grok or ask these large language models more and more, and it's getting more intuitive. And ask it a very specific, question, and it'll give you a very long answer in a very short window of time, and you're able to fact check it now a lot faster, and it's coming back more and more right. Mm-hmm. The problem that you have there is it's only as good as the information that's put in. Sure. Right. So if they would have said it was successful with taking ivermectin completely off the internet, where nobody would ever have been able to see it whenever we can next pandemic comes through, if ivermectin were to go away and not be on the internet, it wouldn't be a potential cure for the next thing that comes through. As it is, we fought through it and we were able to get it. I mean, now we can talk about it again.
Yeah.
So hopefully large language models can learn from it if they are not filtered out. I mean, they still can program them to remove certain words if they want to. That's a real problem for me. We're talking about AI and how we need to have individual control over what we want and what we don't want. Absolute no censorship. We're going to get you. What are you just reading up on ivermectin, or you want?
Well, no, I was going to say that this ivermectin is not made in the USA. It's made in India,
right?
And it's shipped to me from India when I want it.
Mm-hmm.
But you have to prove that you're a medical professional to get it.
Well, I like it better that it's coming from India and not from China right now.
Yeah,
that's just me.
Oh, me too.
Hopefully, we can get it to where it's made in the States again. That's part of the legislation and getting jobs back over here.
I don't know that it was ever made in the States.
Yeah, I don't know that it was. I think the
maybe for the horse
dewormer. Horse dewormer. All right, I got another clip here. It's a couple minutes, and this is more speaking to the censorship side of things, I think.
We talked to Dr. Kelly Victory, and she said, look, we knew how to treat COVID. We weren't allowed to say so. And
you were not allowed to say so,
right.
Dr. Corey.
So that's what she's worried about with bird flu is what you just said. We do know how to treat bird flu. What if we're not allowed to say so if and when this happens as a media pandemic?
Again, you're calling out the playbook, right? So in order to do what we were just talking about, you have to suppress effective early treatments. They did that incredibly successfully in COVID, starting with, and I've talked about this in the journal, I mean, I nailed their playbook. I mean, the number one step is to publish articles in high impact journals showing that these safe, effective treatments actually don't work. They manipulate studies to do that. Then that gives them the foundation to enact all sorts of policies and punishments for those who decide to willfully ignore those august, high quality, rigorous trials. And it's a tired playbook, but that's going to be part of it. You guys know this. That's going to be part of it. If avian flu becomes a real thing, and I did what I did with my colleagues and my organization back in COVID with the FLCC, we try to put out treatment protocols, and people start to use some of the modalities that we recommend, you're going to find the medical boards coming after them. The same stuff, persecutions. I mean, it is really a very it's a rapacious industry. And the way in which they drive business and fight competition, it's not like any other industry at all. They literally go after people's livelihoods, their reputations, their credibilities. It's not like the iPhone beating the BlackBerry.
Right.
A true competition. Here you come up with a different solution that threatens their market. They do not play in pharma. I mean, that is a criminal syndicate. We have many decades of evidence that they literally behave like a criminal syndicate. They do not care about our health. They put profits before people all the time. And they pull these shenanigans to amazing financial success.
So, Dave, part of the reason why I wanted to get you in here, obviously you run in circles. You're a successful guy, now retired. You're willing to speak your mind. You've already told people you're not a medical doctor. But I'm sure you do know medical doctors, and you know people that know medical doctors. And so, to me, part of this conversation and this experiment is we need intelligent people who see these things going on that can share more with the right people, or potentially bring the more people in that might be aligned or willing to be open to paying attention to stuff like this for the next time. I mean, we have to be able to, have a rapid conversation. If they drop something like COVID again rapidly, people are going to go into a fear mode. And where are they going to look? What are they going to do? Are they going to respond the same way? We need rapid conversation. We need the ability to spread out information, not relying on YouTube, not relying on Facebook, not relying on these places. So we need a place where we can signal and get feedback from. You had your higher ups and the dental realm that you were talking to every day, you said. So, I mean, I think that's what we're trying to accomplish here.
Sure.
I don't know, Dr. Roy, you probably didn't have anything on that. We've talked about that a million times.
Oh, yeah.
I got another. This whole thing was about 19 minutes. Just so you know, I'm saving you all probably about half that. I tried to cut out some of the stuff that we've talked about pretty heavily on the podcast, and I'm just trying to get to the high points in this. Again, it's Pierre Corey on Redacted. If you want to watch the whole thing, I highly recommend you going out and following them on YouTube.
No. Is about tuberculosis. We've seen that in the UK, they have a 13% rise in cases over the last year in tuberculosis, which is serious. We see in the United States now 8% increase in cases. Just this week, my son said that someone he knew at school had tuberculosis. And in the year 2025, we do not vaccinate for it in most developed countries. If this had been the pandemic, maybe we would have reacted very differently. Is this a new media scare, do you think? Or how do we assess what the media is telling us now about rise in tuberculosis?
Okay, now you guys are officially triggering me, and I'm saying that somewhat humorously. And the reason why is,
okay.
All right, let me speak to your question. I do not think that is about fear mongering or trying to drive, arms to get vaccines for TB. There is no vaccine for TB, so that for that reason, no. But when I say you're triggering me is that article about this unexplained rise in TB cases. What I get triggered of is that's not the only disease that is surging across the world. There's 13 different infectious diseases that are surging in countries all across the world. Mystery pneumonias, viruses, even older ones. There's strep that's going around. There's brain-eating fungi rises in cases. Innumerable infectious diseases, of which TB is one of them. And what triggers me is every time you read an article by this, and there's one article in Bloomberg for about 8 months ago, which did an amazing review of all the epidemiology of these rising infections. Every article, you know what they come up with the reason for this? Again, this is the not calling out the elephant in the room, which is the massive immune dysregulation, immune suppression after a global mRNA vaccine campaign. That is what we're seeing. That article is literally calling out to these disturbing rises in infectious illnesses that are hitting people in sectors. Like if you read that article on TB, they are finding TB in people without traditional risk factors. Nowhere is it mentioned that there's a vaccine. The one reason they gave in that article for why those TB cases is because of interruptions to medical care from the pandemic. So there's delays in diagnosis. Absolute nonsense. On its face, that makes no sense with TB. You don't diagnose TB until you get symptoms. So don't tell me that this is delays in care. And so it's part and parcel of the tragic humanitarian consequences of the folly of an mRNA global vaccine campaign. And we're paying for it now. People are getting sick with illnesses they traditionally weren't getting sick from, not only infections, but cancers. And that's just the plain reality. I've deeply studied on this, and I'm sorry to be myself fear-mongering, but we're in trouble. What they did in COVID, we're still paying for it. People are getting sick as a result.
Way to go, Trav.
I want to clap and cry all at the same time.
Yeah.
If either one of you guys want to riff on that, feel free to do that.
I do because when I started in medicine, tuberculosis was still a big problem. It was a big problem. They had just closed all the sanatoriums because we have very good ways to treat it at home and in the hospitals. So these people who had been literally locked up in the sanatoriums with tuberculosis, we finally were able to let them go out and let them take medicine and improve. But it was horrible. They showed us some pictures of the kinds of things that they used to do to treat tuberculosis, like removing ribs so that the rest of the lung would come down and squash the area that has tuberculosis, and the tuberculosis could not thrive in an area that didn't have oxygen. So they were killing it. But you see these guys that have, like 6 or 7 ribs removed, and their whole side goes down like this. But it's to kill the tuberculosis. it was about 1956 when they discovered the first drug that was really effective with tuberculosis. And then they found out that it would work better if you had a group of 3 different things you were treating it with in active tuberculosis. But God Almighty, I saw so much tuberculosis when I was taking my gap year. I had a young woman who came in. She was 19, and she came in and had a child, and then immediately got sick thereafter, and her temperature was 104, and the OBGYN called me in, and he said, I checked her. There's nothing wrong. She doesn't have, fever from the birth. And I got a chest x-ray on her, and I saw all these little dots everywhere in her lungs, and her liver enzymes were way off the charts. So I biopsied her liver, and we got it back, and she had TB in her liver, she had TB in her brain, she had TB everywhere. It's called miliary TB. It just goes TB, it goes nuts. And it was because she was, undernourished from having a baby. And we saved her.
Maybe you already said it. Is there effective treatment?
Oh yeah,
okay.
Yeah. And the worst part of it is that the drugs that we used to do back in the 1970s and 80s are less effective against tuberculosis because the germs are getting brighter, and they have now the way that we treat tuberculosis is with a total line of different drugs than we did back in the 1970s and 80s. My TB test went from negative to positive in 1978. I checked myself every 6 months, just do a little stick there, and it came up with a red nodule about the size of a quarter. And I said, gee, I better do something about this. So I took the medicine for a year every day and never had any problems. And if somebody tries to make me take another skin test, I'm going to say no, because it'll probably blow up my arm since I've had TB, not active TB, but I was exposed to TB. And I had some of the germs in my body, at least the antibodies. So I say, just do a chest x-ray. It's fine.
All right. Well, this moving back into this clip, I skipped another few minutes. We're going to, well, actually, no, this is immediately after that last clip, talking about spike protein detox and removal, which I think is, again, another thing that we want to continue hitting on. Just so people, again, you go to the doctor's office, we're not telling you not to listen to your doctor. Me and Dr. Roy have talked about this ad nauseum.
Some of these young doctors have no idea what the spikes can do.
Well, I mean, and part of it,
they have nothing. They don't watch these podcasts. They work 15-hour days, and they go home, and if possible, they see their kids, and then go to bed.
Well, and they're told, the standard of care, that they're not looking for anything outside of, if it's cancer, chemo, radiation, and whatever drugs that they recommend.
Yeah.
So they're not looking at these signals. They're not listening to people because they're, trying to stay within regulation of what they're being told. So again, this is outside of the mainstream, but Dr. Pierre Kory is very well known and trusted in my realm.
Yeah, wow. You were warning about it. I mean, I wish you weren't canceled over it. I wish people would have paid attention to it. Well, you've written a book, The War on Ivermectin. But I want to get you out of here on 2 last questions, Doc, which is, well, how do we treat this? If you have this spike protein, if you've got this in your body, all these people are getting sick, these 13 highly contagious diseases across the world. What is your recommendation for people now to get this out of their body? Can they?
Yeah, so I specialize in that. That's what my clinic does. Let me just speak to TB because, I started a new nonprofit with colleagues called Rebuild Medicine, and we are doing some that RFK Jr. has mentioned as part of his policy agenda, which is that we are furthering research into repurposed drugs. We are about to fund and start a study. I won't tell you what country it is, but we're studying the efficacy of chlorine dioxide in TB. So we're all looking for new solutions for infectious illnesses. But to your question in terms of vaccine injury, Clayton, that would be an hour-long episode because there's no single thing. And even that question of can we get rid of spike protein, we don't really have commercially available tests for measuring spike loads. We do tend to follow spike antibody levels, which we think is a proxy. I do have a number of things that can reduce those levels. I just have not yet been convinced that that's the target. I use many different therapies. Not one thing works in everyone. I can see 2 patients with vaccine injury who appear very similarly, and 2 therapies will work great in the first one and do nothing in the second. So it really I'll finish my answer by saying that is a very complex and idiosyncratic disease for which you need to work with patients, and you have to do repeated therapeutic trials using, pharmacologic or supplements or nutraceuticals that have mechanisms of action that can marry the disturbances in their pathophysiology. And so it's not a short answer, and I'm still working at it. I've been at it 3 years. I am 100 times better at treating it than I was 3 years ago, but I need to be 100 times more because it's still a tough disease to treat.
Well, I had that clip to stop there, and one immediately following that. I think you kind of already hit on that.
Yeah.
So we can skip right through the talk unless Dave, you got something to add. Go ahead.
Well, I was going to ask. I've heard on different podcasts probably at least 2, maybe 3 different people talk about ridding your body of the spike protein. Mm-hmm. Are the people that are doing that on the same page treating that the same way, or is that still kind of a trial and error?
It is still a trial and error thing.
Science in practice.
Not everything works, and he's absolutely right. You may have a group of treatments that you give to one person that works real well, and the next person coming along who's indistinguishable from the other one, you give it to them and it doesn't work at all.
Mm-hmm.
So,
well, I'm wondering. So, I'm curious if he was here in front of me, I would Dr. Jack him. Meaning Dr. Jack Cruz. Are you getting them? I know exactly where you're going with that. But get them out in the sunlight. Are they out in the sunlight in the morning?
Yeah.
Are they doing full redox things? Are they eliminating the EMF as much as possible? Are they grounding and all the things that Dr. Jack recommends? Again, if we're trying to triage and just make sure that we're helping these people as fast as possible, it should be all in. It's like we've talked about the ivermectin and fenbendazole.
Yeah.
It's like if you go into your cancer doctor and you're like, you're stage 4, I got nothing to do, and the chemo's killing you or whatever. Give me the thing that's. Give me the Joe Tippin protocol. If you haven't heard of it, it's Joe Tippin's on Facebook. They've got a Facebook group, and it's not an official doctor. It's not anything that you're going to go to the oncologist and hear. So it is pure science, and it's speculatory. I'm not recommending you follow what they say, but there's just so many people out there talking about here's the things that we're doing, and here's I had stage 4 pancreatic cancer, and it's 3 years past, and I'm still doing these things. So, you hear that enough, and it's like it's not just noise. There's some signals.
Ordinarily, pancreatic cancer kills you in fewer than a year, and it's amazing to me that somebody can be taking those mild things and still be alive after 3 years on pancreatic cancer.
Yeah,
because that's the bad one.
Kill you as fast as
that one and brain cancer.
Yeah. All right. Here's the kind of the last clip. I think this is going to the ivermectin Trump legislation, I believe.
Well, we'll have you. We'll do a whole hour-long interview with you on vaccine injury. We'll do that. So we'll put that on the book. So we'll talk to our team and make that happen. So I will get you out of here on this. You wrote the book War on Ivermectin. President Trump sounding, it seems like major moves towards making ivermectin available to Americans in a larger way. I mean, if you would have said this like a few years ago, you would probably have fallen off of your chair because you were silenced. You were canceled for telling people about ivermectin. I mean, what was your response to hearing the Trump administration wants to make it available more readily for Americans?
I feel not only vindicated, but so satisfied, because I think it's the work of myself and my colleagues. You know, we were conflicts of interest free, deeply studied, scientific, putting out accurate information, and to find that it resonates and is gaining traction. And, you know, you mentioned Trump, but I'm as equally as impressed with the states, right? There's, I think, almost a dozen states now that have legislation on the books to make it available over the counter. Its utility in treating cancer is becoming more and more widely recognized. And so, you know, the Nobel Prize winning discoverer called it the wonder drug, and it truly is. It's unique in our total pharmaceutical armamentarium over decades. It's one of the most unique medicines in terms of its unparalleled safety and broad applicability. And so I can't think of anything better for, you know, furthering the treatment of illnesses than having the role of ivermectin be recognized. So it's very gratifying, and so I'm happy to see that it's gaining traction and people are realizing that we weren't misinformationists. We were just trying to do the right thing and teach people things that we thought could help them.
All right, that's a perfect plug-in for Roy to sell some ivermectin here, and it's still not available over the counter here in Indiana. Dr. Roy does have a very good supply of it. I guess what I'm most intrigued by, and like I felt like having stockpiles of it even. Yeah. I don't know how long the shelf life of it is, but I mean, if we start to find out more and more that ivermectin has much more broad capacity, and I know you're only selling it for COVID treatment. That's the only thing that you're really talking about. But there are these other signals.
You know, once it gets out of my hands, people can do with it whatever they want to. But I recommend only using it for COVID. But on the other hand, I've been approached for now 2 people to one. To use it for cancer, and another one to use it for parasite cleaning. And I don't know whether he has parasites or not, but I'm not going to stop him from using that, because ivermectin works on parasites.
Does the mechanism of action on COVID, being a virus, have the same mechanism basically that it's working on worm?
Yes, it does.
Because you look at a virus on a microscope, it looks like a little worm.
Yeah,
it's true.
That's right. And viruses don't have cells, and they have very few proteins, and it just blocks those. It keeps the virus from reproducing, and that's the whole thing of the why you get sick, is you may only get 24 virus particles, and then they start reproducing, and in a couple of hours you've got 10,000.
All right, so we've been in a very serious mode here for a minute. I had a little bit of humor. This is more in my realms. This humorous to me, because I kind of live a little more in the marketing world. And I found a couple things. One of it is kind of playing on the AI piece that me and Travis have been riffing on here for a good window of time. This one is not. So this is just more, this particular ad. I remember when ads used to be super funny, and is it
a video, or should I show your screen right now?
Yeah, you'll show the screen.
Okay.
You'll show the screen. But this is kind of like old school media advertising, and I find it's so funny, and it's also edgy, and all the things that a good ad should be.
What's that?
That's a swear jar. Every time someone swears, you put a quarter in it.
Who gets the money?
I don't know. We'll use it to buy something for the office, like a case of Bud Light or something.
Fucking awesome. You, Bob. You, Jim.
Eric, I have a bag on line 3 for you.
Can I borrow your pen? Can I borrow your pen?
the owner of a white station wagon please go yourself?
We're going to go down there and we're going to some. We're going to some. We're going to do whatever we have to because we're going to some.
Poop.
Doesn't count.
Shut the up.
I'm so proud of you mother suckers. Here.
Refreshingly smooth Bud Light. Always worth it.
What's
And
that?
we used to have good commercials.
That was awesome.
We
man.
used to have some good commercials.
Well, here's I'm going to go ahead and play this other one because I didn't cue it up this way, but it just so happened that it turned into the same realm but slightly different. Give me a minute here. Just keep up on
poop.
there.
That doesn't count.
Oh, hang on.
I've got it muted right now. So.
Okay. Let me make sure I got all my stuff figured out here. Hang on.
Right, everyone. So it's Friday night. I'm getting ready to go out. This is the look. I'm feeling kind. But before I go out, I've got to pregame. And the only way I pregame is with an ice cold Bud Light. So good. Right, everyone. So it's Friday night. I'm getting ready to go.
That was it. And I only do that poke fun at Obama. That's funny. Whatever. I like the stuff that pokes fun of Trump as well. But just how good AI is getting already. Like, I mean, you could still tell that was a doctored video. But
that was also probably a couple years. That's probably a little older, wasn't it?
Might be a little bit older. I don't know. Well, yeah, maybe.
Well,
It won't be long
The
until you
whole
won't
Bud
know.
Light thing was like 2 years ago.
Yeah. Well, I mean, so to me, that just kind of came in at the same time. I think probably because I clicked on the one Bud Light thing, this one showed up in my feed. But this is the kind of stuff that's going to hit you over the head more and more. So I just found that one humorous. I'm sorry. Just a little selfish pleasure. So there's there's no video on this. And there is information. I don't know if I want to really get too deep into it. But apparently there's an article on Vigilant Fox, and it's talking about Bill Gates is basically releasing a new vaccine for
kill everybody?
for birth control.
Oh, great.
Yeah, and so anyone that's listening to this, if you want this article, reach out to me. But you can do a search on Vigilant Fox. Bill Gates funds slim microneedles tech that self-assembles inside of the body. And so basically what it is, it's a shot, and a lot of people are shot averse, and they don't want to do it. But apparently this one does something with microneedles where you don't really even feel that it's going on. What I will say is, Bill Gates is very well known. He did a TED Talk that was basically promoting depopulation and saying how we're overpopulated and we need 10 to 15% less people on the planet. And somehow he ended up in the COVID vaccine discussion and funding different things. And I don't really understand how he's still walking the planet and able to use his money on these different things and how he has not been shut down. I just don't really get it.
It's got good security.
No, but the fact that he still has the sway inside of these organizations because he throws his money around and he can work on these vaccines that have no long-term study on them. There's none of the things that need to be scienced, and they're just getting shuffled through. So, if you know a gynecologist, if either one of you know a gynecologist, please.
Is this like a plan B, or is it like?
Well, I mean, I'll send you the link.
Because it sounds like you said an abortion vaccination, and I don't understand how that works.
No,
but-
let me tell you what happened about 10 years ago, and your wife knows a lot about this. They came out with some little coils that could be put in the fallopian tubes to make women infertile.
Mm, yep.
And
I do know I know a thing about that.
Yeah.
Like the Marina thing and all that stuff.
Yeah, it's much easier to use those things than it would be to go in surgically and cut the fallopian tubes. Unfortunately, they didn't work.
Mm. And it's made of nickel, I believe.
Yeah.
Which it turns out certain percentage of women have adverse effects to nickel in their body.
There's a lot of people that are allergic to nickel. Actually, nickel free, like jewelry. I was in the jewelry game for a little while. There's a big nickel allergy.
I had a 14-year-old girl come into my office, and she had this ginormous rash on her stomach. And she said, "What is going on? What's going on?" So I said, "You're wearing blue jeans, aren't you?" And she said, "Yeah." And I said, "Well, the back of the plug
button or whatever
is nickel, and that's why you've got this big thing. You're nickel allergic." And
so the button of jeans is called a cluck.
A cluck?
Is that what you just said?
No, I didn't say that.
Oh.
It's the little thing that clicks together.
Oh, okay. I thought I was like, there was probably a name for it. I had no idea it was that.
Yeah, it's called a button.
Well, yeah, no idea. Yeah.
Snap is what it is. It's the snap on blue jeans.
So just to circle back around to you, Travis, and answer your question, I asked Grok to give me a short summary of that longer article. The article discusses a new contraceptive technology called SLIM, self-aggregating long-acting injectable microcrystals.
Sounds totally safe.
Funded by Bill and Melinda Gates Foundation. SLIM involves microneedle injections that form a self-assembling implant in the body to provide long-acting contraception without surgery or removal procedures. The technology, developed by Lindra Therapeutics, aims to be ready for humans use in 2028, but lacks long-term safety data.
Yeah.
How do you get rid of it? You said that it's
that's not important.
I know, you're right.
So
we just need to make as many women.
So
infertile as we can.
it's not
Crazy.
just if you want to trust Bill Gates, do so at your own behest. The problem is if I'm sure when this actually gets in the hands of gynecologists, they're probably not going to know that it came from Bill Gates. So just the fact that we know what he has said over time, it's not just having good birth control. He said we can use vaccines to depopulate the planet. That is not birth control.
No.
So
it's people control.
And you wonder if that's being marketed at Western society.
Well, I mean, they said it's not ready for human use until 2028. So, but is it being tested right now? So people are in studies for it.
They probably take it to Central Africa and test it there.
Yeah.
And of course, Elon says the biggest risk we have is depopulation.
Yeah, he believes we are severely, rapidly declining, and it's not going to be enough to care for everyone. And that's something that he and I sometimes riff on, and me and Travis. But I don't, I don't think we're overpopulated by any stretch. I think there's just a lot of people that want to control everything, and
sure,
I don't think we're physically overpopulated.
We're trying to scare our kids not to have kids. We're trying to scare them that they are an organism that's making the planet warm. I mean, it's a depressing conversation. If I was a kid now, I don't want to bring another kid on the planet. I've heard my 20-year-old say, I don't.
A lot of them don't.
And so, I mean, to me, that's beyond. Well, we just shouldn't because it's not good for the planet. It's a deep psychological.
Well, that and there's a big economic impact in that regard as well. I mean, it's just gotten more and more expensive to raise a child anymore.
Anyway, so that's not exactly a segue to this next thing, but there has been some good news. I believe it's good news. And we've talked about since the first Trump election. I mean, we weren't podcasting back then, but back when the first election went through and they started using lawfare on him and other political enemies, one of the things, my wife being in the legal realm, we've always talked about advocate judges and the dangers that advocate judges bring to advocacy judges that push politics over law. And obviously that's been going on for quite some time now. So this is a really interesting clip to hear, I think, just in regards to what's been going on and some of the arrests that are now coming down the pipeline. I don't think we said that while we were on air, did we? But there's been some judges that are being arrested, and or there's been a couple that have quit, I think, based on some of the things they've been caught in. Here it comes. Should be. Oh, wait. Sorry. Start again, Trav. Oh, man.
You got it all jacked
Well,
up.
remember the clips all have the things in the wrong spot.
Yeah.
I know.
He is being treated no better or worse than anyone else. This is not selective prosecution, that this is not somebody who's singled out, that he is being treated just like anyone else. That is what it means to have a rule of law. That is what the Justice Department is really signaling and messaging here, is that everyone will be treated, as Merrick Garland has said, as equally in this country. This is really a great day for America. So there has been a violation here that we know for sure, and it is not the judge. Right, exactly. You don't do it. Even if you thought that there was a ground for doing this, the judgment call that you thought that this is the case to bring, it tells you everything. There is no adult in the room who would have said, "Are you kidding me? Why would you possibly do this?" And the answer is because we want to send a signal to the judiciary. And that's what you shouldn't be doing.
Yeah, so you want to know why Trump is winning more and more different categories of he's getting a lot of Mexicans. He's got a lot more African Americans in the last election, a lot more favorability and support. And mostly it's because I think people are seeing the things that have been done to him.
Hypocrisy is one of my biggest pet peeves.
They themselves have been victims of these things over time, and they're just like, finally somebody's just going to be held accountable to this stuff. So, I mean, I think it was just a kind of a primary signal of that.
That's what we were talking about earlier. Somebody's going to have to be held accountable because there's all the...
He was pardoned before Biden left office. Sorry, that's my Fauci poke for the day.
Yeah. Unfortunately, they were signed by an electronic
pen.
Yeah.
And
Well, that and hopefully the states will go after him. I mean, there's a lot of angles here, but ultimately that dude needs to be in a prison cell.
You think?
I do.
Okay, so we'll just keep on plugging through here.
Oh, I like this bloke.
He's a good one.
I'd use bloke, like colloquialism for him.
Now, in a minute, we're going to be listening to Dr. Jay Bhattacharya, who, of course, is the new director of the National Institutes of Health. And Secretary Robert Kennedy has asked him to look at the causes of autism. And he's also looking at data now from the mRNA vaccine technology. Now, he's getting access to all the data from the National Institutes of Health now that he's currently analysing. And that data hasn't been released in full yet, but it does confirm some of our worst fears about the dangers of the COVID vaccines. So he talks in this brief interview about the uptake for the COVID vaccines basically collapsing in the United States. Now, sadly, they're still being advised for some people in the United Kingdom for reasons I find somewhat strange, bemusing, whatever term you'd like. Dr. Bhattacharya, who's a doctor, is a physician, is a researcher, a very highly published medical academic. He said it was good that the childhood COVID vaccine uptake was low, despite the recommendations that were going around at the time. But basically, he says that COVID vaccines are dead now in the mind of the public, but, and there's a big but here, he's got now new data on the mRNA technology that, as I said, does confirm our worst fears. And let me give you three specific examples of what he talks about. First of all, he talks about the theory. Now, the theory, of course, is you have a small dose of an mRNA, it goes into your arm, it just stays exactly in your arm, doesn't it? It never goes anywhere else. That was always nonsense. And it produces an antigen, and your immune system produces response to that antigen. An antigen being anything the immune system recognizes as being foreign, and it will produce an antibody and a cellular immune response to. So that's the idea, that's the theory. All sounds really good. In fact, someone was given a Nobel Prize for that. But what's the reality? He talks about the reality, and the reality does confirm what I've been thinking for 3 years now, basically, and what senior doctors and scientists around the world have confirmed or said to me that they believe is true. That's now being confirmed by actual data. And the first one is the dose of the antigen. So when you give this certain amount of mRNA, and he says you can control that, the dose of mRNA that you give to some extent, you just said to some extent, But you can't control how much antigen that's produced. So in some persons, it might produce a little bit, in others, it might produce huge amounts. And in other people, we know that spike protein is still around after very long periods of time. So you can't control the antigen. You know, this is just goes against the axioms of healthcare. You give the right dose of the right drug to the right patient at the right route at the right time. You know, you give the right dose, but we don't know what the dose is. It's a random dose. The dose can't be controlled. How can regulatory bodies still be approving this if they can't control the dose of the antigen that the mRNA vaccine gives the body? Next point, biodistribution that he talks about. No control. No control over biodistribution. Now, if it's given via an inadvertent intravascular injection, that's particularly bad. But these lipid nanoparticles are so small, even if you give it with the best intramuscular injection technique in the world, which, to be fair, is not done very often, but it still goes everywhere. Everywhere, meaning your brain, meaning your thyroid gland, meaning your eyes, meaning your heart, meaning your liver. And the anatomy here is well known. I've taught it for a few generations now. You know, something goes into the arm, that's into the systemic circulation, goes into the heart, the left side of the heart pumps that to the entire body. It just goes everywhere, systemic distribution. And that's, Dr. Bhattacharya says, that's why there's harms, and he used that word harms, in many body systems. So there can be adverse reactions in many body systems because of the systemic distribution. So can't control the dose, can't control the biodistribution. Third point, antigen is not fully predictable. So this mRNA code, you can get what you call frame shifting. You can actually like jump a code letter. So you can get different proteins produced other than the exact antigen that you were trying to produce in the first place. So the dose is not predictable, the biodistribution is not predictable, and the antigen molecular architecture is not completely predictable either. And one thing that really concerns me, and we haven't heard much data on this, but I'm really concerned that these frame-shifted proteins that the mRNA code makes anywhere in the body, I'm really concerned that could produce a prion. Now, a prion is a proteinaceous infectious particle. For example, you might have heard of it with Creutzfeldt-Jakob disease and bovine spongiform encephalopathy, so-called mad cow disease. And what happens in prion disease, it's a proteinaceous infectious particle. So it's not a virus, it's not a bacteria. The protein actually changes the shape of other proteins that it comes in contact with, and you kind of have this cascade effect. So I'm really concerned that an antigen is produced, which is not the one that we wanted to produce, but has actually got the potential to cascade and adversely affect other proteins. Now, I don't have evidence for that occurring, but I certainly think we should stop these vaccines until there's evidence that that is not occurring. So Dr. Bhattacharya says we can't control the dose, we can't control the biodistribution, we can't control the exact nature of the antigen that's produced. And he points out with some irony that there was a Nobel Prize awarded for this work, but it's going to take a couple more Nobel Prizes before it's ready for public uptake.
So just so everyone knows, I'm trying to support the things that you're not hearing. There's not enough time to hear everything that's going on out there. Dr. Jay Bhattacharya is on the Trump administration RFK team, and I wanted to give some hope there that they are looking into this mRNA stuff and they're taking it very seriously. I believe Dr. John Campbell, who this clip just came from, is on the advisory team. He's part of the think tank. He's part of the ones that are seeing. He's obviously very well learned and paying attention to these things. So I think the right conversations are being had. But in the meantime, the reason why I keep bringing them up, maybe we've got some nerds on here that want to really pay more attention to the more technical stuff, and there's a lot of researchers on here. But also, just to reiterate, do not take an mRNA vaccine. If you're in my family, if
my family,
anybody that you just talk to some doctors that are skeptical. If you're getting a vaccine for a particular reason because you feel like it's going to protect you from something that's life-threatening out there, that's the reason we're talking about tuberculosis. That's the reason we're talking about bird flu. That's the reason why we're saying all these things, because they're trying to stoke up fear and jam these things into people as fast as they can. And we don't know what they're doing when they get into you. There's no real study that's telling us exactly what's happening. Is that what you kind of take from that whole clip, Dr.
Yeah.
Roy? Yeah.
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 Well, that was easy.
I have to say just real quick, just because of what you're kind of saying there, but you know, my wife and I usually see eye to eye on most things politically. Well, she really puts her head in the sand on most things. She just doesn't even care to know, and I'm supposed to be the one that provided the information to know what to do. But her and I are getting a little knuckle to knuckle on some things, mainly from this podcast.
I'm sorry.
Because no, seriously, because she's you know, you'll post some things online and she'll go, man, I might have to take him off Facebook. And then she goes, and it's bleeding into you too. And I said, so I'm starting to get educated. Like, what's the problem?
Mm-hmm.
But anyway, she brought that up just a couple of days ago. I just thought it was
okay.
Well, there's nothing against you. It was
Hopefully she hears this, and I apologize if it makes her uncomfortable. I would not.
Well, it's supposed to make people uncomfortable.
Well, the problem, the reason why we reacted the way we did in COVID is because we were trained to not only be afraid of things and listen to authority figures, but we're supposed to fall in line. If you fall out of line and you say what's not popular, you get ostracized, you get treated, demonized, you get canceled, you get licenses taken away, you get all these different things that happen to you. And in the end, more times than not, if I say something really stupid and it turns around that I was wrong about something and it comes back and smacks me in the face, I'm going to say, hey, I won't do that again. I'm really quick to say I was wrong about something. So I like it. If any of this stuff doesn't come out to be true, or any of these people that I'm trusting to share information about or with turn out to not be truth tellers, I won't follow them anymore, first and foremost. I'm trying to take them off the list as quickly as possible, but I'll also admit when I was wrong.
Sometimes it's not just the truth, it's just the ability to talk and question.
Yeah.
Because a lot of times we don't know, and that you have to be able to throw it on the table and have a discussion, have it looked at to know. So it's not a matter of lying a lot of times for people like this. It's just a matter of this is what they're seeing, and this is the way that they feel that it is.
I mean, I think
and it may show that they're right, it may show that they're wrong.
Yeah.
But if you can't talk about it and you're canceled, we get what we had.
Well, I think if you're lying and you're profiting, you're lying. You're lying for profit.
Yeah.
If I'm saying something that turns out to not be true, I'm not making any money off of it, and I'm here truly to try to figure out what's closest to right at any given moment, so I can hopefully give my kids the right advice in the moment. Because I have them ask me these random questions out of the blue, like, "What do you think about the tariff?" or "What do you think about the whatever?" And it's like, I could tell them to turn on a news channel. I'm like, no.
But which one's going to tell them the truth?
You know, not going to do that.
Not one of them.
Not going to do it.
Wouldn't be prudent.
Wouldn't be prudent. So, so for me, part of this thing is, I know that it's going to make some people uncomfortable. I know that I've been unfriended or unfollowed, and I haven't really met anyone in public that has pulled away from me. Mm-hmm. And I'm okay if they don't want to hear the things that I say on Facebook. You know, I don't use Facebook to share food pictures that much anymore. To me, it's a potential to just recognize that something went really wrong back in 2020, and to not forget the lessons that were learned. And so, hopefully, this can all go away, and we don't have to worry about beating a dead horse over time. Things just get better magically.
Yeah.
So let's kick a little bit of humor into it. I got several couple last things. I know we're going into the 8 o'clock hour, probably almost about 2 hours.
2:06.
There's a couple of different paths. There was a Department of Defense insider who was forced to resign, Nicholas Terza. I don't know if you guys have heard of that story. But he's now under investigation. He basically got caught on tape by the organization that catches a lot of people on tape, but he was caught saying he was going to do everything to be a dissenting voice and to stop everything that Trump did from the very beginning. And he's a high-ranking official in the Department of Defense. And so me and Dave were talking about it was, thank you.
Yeah.
Me and Dave were talking about the NGO situation going on and where all the money is funneling through and back to our senators and whatever. But it's people like this. This guy obviously is an insider with Department of Defense and what they're trying to accomplish there. And they see Trump as a threat to the establishment and the how everything is, the money is
to their meal ticket,
to everything that they're doing, and they all think they're smarter than him. And maybe some of them are smarter than him. At the end of the day, that's for us to decide. Speaking of smart, let's do a little more humor, and then I'm gonna figure out a couple more clips to watch, and then we'll probably round it out. Dave, you out of bourbon? You need.
I'm good.
You
right
need
now.
another
Yeah,
squig.
I'm good.
You guys, Nate Bargatze's coming into town here pretty quick, and he's a super funny guy. And I, for whatever reason, both me and my wife love him. I mean, we both like comedy, but this particular clip is extremely funny. And if you've never heard of Nate Bargatze, this to me is like you just have to listen to him. I can't do it better than he does.
Yeah, and I think that matters. Reading is the key to smart, I believe. And I don't do it. I think it's caught up to me. I want to do it. I like the idea of reading. I even buy books. But these books are the most words. And it's every book. You just open it and you're like, what are you talking about? And they don't let up. Every page, just more words. How about you put some blank pages in there? Why don't you let me get my head above water for 2 seconds? I don't read.
That's it. But, sorry, you got to slide in some humor, and he's coming to Evansville here shortly, I think, or maybe the next couple months. I don't know if he still has tickets available, but if you're in the area, I highly recommend it. I think his current tour might be called Big Dumb Eyes, but like everything he says is like he's making fun of himself all the time. He doesn't cuss. He's very clean. He's just a super funny dude. We haven't showed any RFK ads in a while, so I feel like promoting RFK just a little bit.
Do you remember the goosebumps we got from that one?
Oh man, I don't know. Dave, did you see the ad? I think he was still running for president, wasn't he?
At the very end, no, because at the very end of that, well, it depends on which one you're talking about. The one I'm thinking of is at the very end. He's walking out to Trump on stage.
Oh yeah,
like that's like the very end of it. So it's right when I guess he's declaring his partnership.
So
with
it was
endorsed.
If you don't love me now,
yeah.
Who is that? Fleetwood Mac.
Fleetwood Mac, yeah.
It was a Fleetwood Mac commercial, and whoever.
Well, that was the audio of it.
But So they had agreed to promote. Obviously, him. They agreed to allow the song, but it was one of the most powerful ads that you've ever seen. It's the most powerful political ad I've ever seen.
It was about JFK getting assassinated, then RFK getting assassinated, and it's at the times where they were trying to bring light to different situations. It was just really good. It was very good.
And RFK was trying to get answers about his dad and about his uncle, which that's a whole other interesting path that we need to kind of go down. I think at some point he only agreed to connect and get involved in the Trump administration because Trump promised him to get all the inside information about JFK and RFK and Martin Luther King, and that whole thing just kind of went quiet. So it'll be interesting to find out where we go with that. But this is another powerful ad. I just if most people haven't seen it, I'm gonna share it.
Years, I prayed every morning that God would put me in a position to end this calamity. I have the certainty that this is what I've meant to do. The only thing that will save our country is if we choose to love our kids more than we hate each other. We will make Americans healthy again.
That was it. Really short, but very maha. And so that leads right into the next couple pieces, I think, that I want to kind of end the program on.
What do you have with Mike Rowe?
Oh, well, that was, it's kind of off topic today.
I love Mike Rowe. I think he's great.
So highly recommend him on the Theo Vaughn podcast. He's talking about tariffs and workforce and all that. This is a great podcast. It's not really kind of fitting into the track that we've taken today. I will try to bring that back. I think I got another education track that'd be a really smart one. So here's another RFK thing. This is kind of another thing that I think is that my 2A guys here will really appreciate.
By the way, Dairy Queen, there's no dairy at the Dairy Queen. Don't eat at Dairy Queen. Don't eat at McDonald's. Don't eat at Chick-fil-A. Don't eat at Burger King. Don't eat that chemical warfare. thank God for Robert Kennedy Jr., going to ban putting chemical warfare in our foods and medicine. Oy vey. So finally, in 2025, after the Ronald McDonald Cancer House and all these bald-headed kids having chemo and radiation because McDonald's poisoned them, Burger King poisoned them, Kellogg's poisoned them, Post Cereal poisoned them, Chick-fil-A poisoned them, all these colored drinks poison the kids, and then they charge us to treat their cancer. Cancer is an industry. Quit eating poison. Welcome aboard, RFK. Welcome aboard, Donald Trump. Welcome aboard, conscientious thinking families. Get the chemical warfare out of your kids' diet, for starters, anyhow. Queen. By the way, Dairy Queen, there's no dairy at the Dairy Queen.
Ted Nugent. That's funny because I don't know. There was a time when he would just anything that moved, he would shoot and kill and eat. So like he's probably not. Yeah, he's probably not one that had to eat McDonald's or anything. He would.
Oh yeah, he
deer, elk,
eats it off his range.
bear, whatever.
He always says he eats what he kills.
He does.
Yeah.
Uncle Ted. He's
Uncle Ted.
He's a very provocative, very offensive, but he says it pretty well like it is, in my opinion. So I thought I had another RFK. There's a couple short RFKs with Bhattacharya, and I want to try to get into here real quick.
Real quick, like.
Well, not so quick that it's. I got another little clip on education that I found really interesting, but again, with how we flowed, is not really that flowing for this particular cast.
But you know we're down with education here.
We are. Maybe, regardless, I'll show you the clip because I find it. It's something, Dave, he and I are trying to tackle some of the education things we got going on with rapid advancing AI. And we know there's a lot of things that are going to be changing so rapidly that we,
And a really crappy Department of Education, which I'm glad that's going away.
Well, we hope it's going away.
We hope so.
We hope it's going away. And I think that just gives more freedom to our local school systems to probably respond and react in a lot better way, a lot more rapid way. The individual, to our local area much faster and not from the top down as it typically happens. So here, I believe, is one of the clips. If you give me 1 second before I cue it up here.
Yeah, I think you're muted.
I am. I'll figure it out.
Yeah, the problem is going to be with the education is that the local higher ups are going to have to give up some of their money. That's the problem.
Yeah.
There's superintendents and things making $200,000, $300,000 a year. That is not.
Yeah, for what?
For what? Like, what are you doing?
If our education was fantastic and getting better every year, I would say.
Yeah, if you
that's fine.
Get paid what you're worth, maybe they'd make minimum wage at that point.
Did you guys hear the fact that in age 6 and age 8, children in public schools in Louisiana and Mississippi scored higher than children in California and New York?
Oh wow!
Well, I'm not surprised about that.
That was just announced.
Ages 6 and 8 or grades 6 and 8?
Ages 6 and 8.
Yeah, at that age,
they were doing better in math than the kids were doing in California and New York.
Well, in California, it'd have to be how many homeless men are crapping in the street, plus how many. Never mind.
Yeah. Well, but Mississippi and Louisiana are supposedly the two lowest in the states of all of that.
And race to the bottom.
You've inspired me to share these two clips and then share with the education to end, just because of that. And it's not a very long one. I don't think this one's that long either. Let's go.
Do it.
Oh, yeah.
In all this. One of the major problems that I think that
this is Dr. Jay
parents
Bhattacharya,
around the country have faced is when they go to the scientific literature, they come back with a stone wall. They hear that, well, the science hasn't been done, it's not rigorous. And part of the problem is that scientists are afraid to ask questions, basic questions that parents want answers to. Secretary Kennedy has asked me to, for instance, to initiate a study on autism, the cause of the rise in autism. It's a question that is at the front of the minds of so many parents across the country worried about their kids. And yet, scientific progress on this has been slow because scientists are frankly scared to ask the question. The goal of my leadership at the NIH is going to make it so that those questions are no longer taboo among scientists. Scientists need to work on the things that actually are at the top of the minds of the American people. The mission of the NIH is to do research that extends the life expectancy and improves the health of the American people, and that's exactly what we're going to do. Since 2012, the United States has seen no increase in life expectancy, none. And it collapsed during the pandemic, and only recently has it started to come back up to 2019 levels. That is a situation that is a catastrophic failure of the American public health system, and it frankly is also a failure of American scientists to address the key drivers of this enormous chronic disease crisis we're facing. And I'm really grateful to Secretary Kennedy for his leadership, and I'm grateful to President Trump for his leadership in giving us the opportunity to turn the ingenuity of American scientists to the questions of how to improve American health and to make America healthy again. Thank you.
That I thought was a super powerful statement. Roy or Dave, do you have a comment on that?
Well, the whole thing about autism, I did a little work this afternoon myself on autism. And you know how everybody says that the Amish have no autism and that they eat fresh food and all of this. Well, there was a young lady dressed in an Amish garments in Walmart this afternoon, pushing a cart around, and she was packing it in with a lot of stuff that I wouldn't even touch,
They probably weren't Amish at that point. It might have been like a Mennonite.
I don't know. I walked up to her, though. You'll get this. This is the main thing. I walked up to her and tried to start a conversation, and she was autistic as hell. I can see it. I'm a doctor, And she was like, no, yes, no expression on her face or anything. So there are autistic people.
Maybe that's because the white devil was trying to talk to her.
The what?
The white devil. I don't know. Like,
Yeah.
you're not part of her religion. Maybe they're not allowed to talk to you.
I had my Bible under my arm. And that's the thing. That's why I think people say there aren't any autistic Amish. The thing about it is it's known and it's sort of normal for a lot of them. You go out to the Amish places and start to try to get a conversation with some of them, and you'll notice that they're not all there, guys.
Well, it depends on your topic. If you talk about churning butter, I bet you'll get a lot out of them.
Well, I wouldn't.
Dave, you don't have family that's Amish or Mennonite
or Mennonite. No.
Oh, well.
He got real quiet over there, making sure that he wasn't offending anybody in his family or anything.
I'm not trying to offend. Well, I guess I'm kind of joking a little bit, but
No, none of that. One more really short clip from RFK here.
Manto with Notice. I'm wondering if there's any pharmaceutical additives that you'd like to eliminate.
We're going to start on that next. I don't have anything particular there.
That was it.
I just like that he walked up and went, huh.
Yeah.
That's a big question.
I'm not stepping into that one today. It's sometimes it's the non-words that speak as loud as the words. So we're not going to go on a big education riff today, guys, and we're wrapping up here. It's 8:15. I know Dave and Roy got a little drive to get back to the house here. I appreciate both of you.
As we talked about earlier, RFK is a wrecking ball. He's not there to be the scalpel. He's there to take it down to ground level and start up. And just like Elon and Doge, they're going to take out some good parts that'll eventually have to be put back in. But It's like weeding a garden. After you get so much weeds, you can't pluck them out. You got to just knock it down to the ground dirt and start over.
100%.
I was checking to see where we are with the Doge. We're at 371 billion currently saved with the Doge.
Hey, that's pretty good.
371 billion. Yep.
Yeah, we need.
Is there an actual?
There's a debt clock. The U.S.
debt clock.
The U.S. It's on the U.S. debt clock.
Okay,
so there's
gotcha.
a U.S. debt clock. Now the Doge wasn't always on it, but now, it's there's actually a spot there. So it's constantly climbing, of course, but it's at 371 billion right now. Savings per taxpayer is about $3,300 right now.
I'll take it.
Yeah.
I check it every once in a while.
Trump did not destroy the economy. The Dow Jones has.
It's climbing back up.
Yeah, it's right at 40. Bitcoin is at 94,443 today.
Yep.
So we're kind of Bitcoiners around here. We're paying attention to it. We didn't talk about any currency stuff or decentralized stuff today, but we do mix it in. So I don't know if that's something that
No, I think it's a powerful tool.
Toy around with that.
Yeah.
Yeah. You look at Bitcoin. It's there for an investment, but it's also there as a tool, as a monetary tool to purchase. And of course, right now, people look at it to buy and to make money on. But, I think it's much more powerful as a tool of actual money than it is as an investment in the long run. Mm-hmm. And, of course, right now, it fluctuates, and that's where people make money. And that's
lose money.
And lose money. But that's the hot
It comes
topic.
back if you don't jump out of it.
So that's the hot topic when you talk to your friends is you tell them, I got some Bitcoin, I made money. But to have a tool that's decentralized is so much more powerful than the investment aspect of it. But we haven't got to talking about that yet.
No, I mean, we talk about decentralized medicine a lot, and decentralized currency. I actually have a shirt that says decentralize everything, and it's not because some authority or some organization in some instances isn't helpful, but anytime you have a system that is dominated by fewer and fewer people over time, there's always absolute power corrupts absolutely, and it'll always come back to bite you, I think.
You brought up the Dow, so I just have to say this real quick. What nobody talks about is the Dow on October 30th of 23, let's say, was at 33,000.
Yeah.
Right?
Yep.
What's it now?
Well, currently it's at 40.
Just over 40.
But it did get all the way up to almost 45. And the fact that it came down to, what was it, this low here, 39, everybody was in a tizzy. Yeah. Trump was blowing up the economy. Everything's going to hell. Yeah. The world's sinking. All of us were going to die.
Yeah.
But just a year and a half ago, it was down to 33,000. And it's up to 40,227 right now.
Sure.
Something nobody ever talks about. We were talking about how media skews things. I just thought I thought I'd bring that up a little bit.
Well, I think we need to talk about tariffs on the next episode. We don't have time to really do it justice today.
I wasn't even talking about tariffs, just the Dow.
Well, I mean, that was part of the signal, and the media was Trump's did this thing with tariffs, and then the economy collapsed. And what they don't tell most people is the people that move money around like that do things to keep the control and the power, and they do things to politically realign. And Micro actually is talking about that in his podcast.
I love Micro.
But there's a lot of people on all sides that don't think tariffs will work. So, and I don't know. I'm not an expert.
It's not so much the tariffs; it's the threat of tariffs that has gotten everybody's attention.
Yeah.
I mean, Vietnam came back and said, "We'll give you 0 to 0," and they accepted.
I think Canada backed down eventually, didn't they? Has Canada backed down since the initial?
Oh yeah. Well, I mean, at the end of the day.
Anyway, we're not supposed to talk about it today.
No. So, but I mean, but it's all for me. If we're talking about how the media tries to control the narrative, we're not really getting deep into the tariffs, but they are just trying to scare you for political affect.
Yeah.
They're just trying to get you to not like Trump in this particular instance. But at the end of the day, again, so if Trump's doing tariffs because he thinks it's helping blue collar, which we've lost our small towns, we've lost, we've got boarded up cities.
Thanks to NAFTA.
Yeah, I mean, the Theo Vaughn Micro podcast talk about that because Theo goes to a lot of small towns and he's talking about all these boarded up cities in Louisiana and everywhere you go. It's like, how do you, without manufacturing, how do you bring those places back to life? I mean,
we have to bring the essential production back to the country just from a security standpoint.
Right, yeah.
you know, even if they're not all that net positive in sales because it can be produced cheaper elsewhere, having the ability and to be able to produce at time of need, you know, relying on China at a time of need is not what we want to do.
Not at all.
Well, what, a lot of the things that they've said about the war in Ukraine and Russia is how warfare has changed and everything's going to drone warfare. And China controls 90% of drone technology and production. Same thing with our climate catastrophizers in our country who want to go everything solar and wind, and yet 80% of everything needed to make put those things online are manufactured in China. And the same people have no clue that China absolutely does not want to help us in the long term. And we are a mortal enemy.
Yes.
But they knew they could never beat us on land. They weren't coming here and invaded because we all have guns. And you know, I think part of it is they actually want to take over our territory, so they don't want to destroy it. They're just trying to make us collapse.
Yeah. Well, I was just going to say, I mean, some may know, some may not, but the most popular by far amateur drone company in the U.S., like as far as purchases, is DJI, and that's straight up. It's a Chinese company through and through, and you have no way of knowing what they control. I have a couple of DJI drones, and I use them, but I don't do anything that I care that anybody would see or know.
Wasn't there even questions that as far as what was in the chip of the DJI?
Absolutely.
Yeah.
Well, there's transformers we talked about that a couple. I need to find that clip for you, don't I? I never did send it, did I?
You didn't send it.
There are transformers being made in China that come over here that were being shipped during the Biden administration. So they were being shipped, and then during the first Trump administration, it was found out, and he put kiboshed that or whatever. I don't know. He made sure that we would no longer get transformers from China. And then Biden administration came in and we started large electricity transformers. I mean, for our grid.
Yeah.
Well, it come to find out there is a kind of a part of the construction of those that has an off switch pretty much. I mean, if they want to shut it off, they can shut it off. And so the Trump administration has come back around to try to reduce those again, but there were a lot of them. There were like 90 to 100 of them or something, I think, during the Biden administration that came in. And I mean like large, not like the thing you see in your backyard on a power pole. I mean stuff in like substations and things.
Well, the reality of it is all technology is if it comes through China and their technology is getting so smarter, quote unquote, smarter and smarter, and the chips are smaller and smaller, they have access to basically everything that's smart. Mm-hmm. If it says smart on it, they've got a backdoor into it. They can hack it. They can figure out how to use it against us. That's critical because all of our infrastructure, everything that we run off runs through Wi-Fi, through routers, through all these different things that come through them. And people are just oblivious to the fact that we have to manufacture these things. Like AI, there's no way we should rely on anything from China for anything related to AI. There's no way we should. Power.
So like even solar, wind. You've talked about solar and wind, some of that stuff, but solar, wind, but even just our grids. Yeah.
Pharmaceutical, anything that you got to put into your body.
The adjuvants.
I'm sorry. And I'm not saying this just to pick on China right now, though they are the biggest adversary. It's anywhere. If it's critical to our safety, security, and long-term survival, it should be manufactured within our realm.
Absolutely.
Hands down. So that's all the
hopping off your
talk we need to have about tariffs.
That's what RFK Jr. said. He said every pharmaceutical should be manufactured in the United States.
Yeah, 100%. So on that, we can end sliding back into the education realm. Is education, civics training, history, being able to have conversations like this. It's super important to the long-term survival of our country. Our kids, I think, me and Travis are lucky enough to have kids in a pretty good system. I think it's not a perfect system, but they are open to hearing the things that we have to say. They're open to critique, and that's the benefit that you get from decentralizing education. Is you have the opportunity to sit in on meetings and talk to the teachers and talk to the administrators, whereas the larger systems, basically the teachers' hands are tied and they just do what the higher ups.
Yeah.
When it kind of becomes like a I don't want to say a service industry, but ultimately they want to do things to keep you there because you're paying them at that point. It's not some government funding or it's not So they want to make you happy. They want to make sure that whatever's happening is in your best interest, because you'll leave and go somewhere else and then they'll lose that money.
100%. Well, I mean, just a couple of weeks ago, whenever they had some kind of widely publicized protests on, we happened to be driving through, I think it was Madisonville, Kentucky, and we ate at a Mexican restaurant downtown, and at the state house or the county courthouse or whatever, there was a fairly, it was a good turnout, and they were loud and playing music. There was a wide range of people, a lot of people with blue hair and pink hair. And there were some obvious people that were just there in that capacity. But it was funny. There was a certain segment of people that I looked at that I felt like those people look like they're semi-professional, probably government type of people. Like, they're like professional, well-dressed. I'm like, that's not, it just something looked different. Typically, you see a protest, and I hate to say the word stereotype, but you look and say, "Oh yeah, that makes sense." But this one, I was like, this one had more organization to it. So what I feel in my own head, and I just did, I don't remember what the deductive reasoning part of it is, just pattern match. But to me, I'm like, okay, Doge is cutting all these programs, cutting all these dollars going to all these people, and I think a lot of people that I saw in that corner were people that are getting dollars cut. Like they weren't out there just because they were mad at Trump or scared of Trump. They were out there because something got cut and it affected their bottom line.
Right.
So anyway, the reason I want to end with this clip first, lastly, it was this kind of the last education clip. We don't have to go out on it. We can come back and say a couple more words before we get out. But education is significantly important. We, at least for the next 4 years, we don't have to worry about the federal Department of Education. So hopefully we can start pulling in, the type of education that we need to prepare our kids for what's going to be happening in the next 5 years with rapid AI deployment, with, our kids have way too much screen time. They're less and less able to have conversations with people and have robust conversations. I try to have conversations with both my kids as often as possible and make them question people, to question things. Don't believe things just off what you hear, but, critical thinking, questioning things, the scientific method of going through the process. These are all things that need to be done. So let's listen to this clip, and if you guys want to riff on a little bit before we go, that's cool. Other than that, I would just want to say thank you again, Dr. Ogle and Dr. Roy and Travis for being here, hanging out today. I think these things are essential, and I actually thoroughly enjoy them. Here we go.
Two women, they were public school teachers for decades and decided this is not the way to do it. Putting kids, gluing them to a desk with a chalkboard in front of them and 30-minute recess. They said, this isn't the way to do it. Let's do a farm school. So they started a one-room farm school. They spent 3.5 hours with academics. It's a classical education. And then the rest of the time, they're with the animals. They're learning to garden. They're learning life skills. Watch.
Buried underneath the lies that you believed, safe and sound, stuck in the ground, too lost to be found. You're just asleep, and it's time to leave. Come on and rise up, take a breath, you're alive now. Can't you hear the voice of Jesus calling us out from the grave like Lazarus? You're the kind of love that washes sin away. Now the door is open wide, and the stone's been rolled aside. The old is gone, the light has come, so come on and rise up. Take a breath, you're alive now. Can't you hear?
So obviously there was a Christian element to that.
Unfortunately, there was a lot of text
Yeah.
So anybody listening, if you want to go back and kind of rewind it,
the messaging was really, really good.
Oh yeah, it's very, very good. And I don't know why they never really taught life skills. They kind of did. Like I had home ec. I don't even know if they have home ec anymore, but they used to have home ec and like
They did.
auto.
Back in my day, they did.
I know,
Yeah.
but I mean now. I don't know that they do now or if they do now.
They had,
I don't think so.
But-
automobile mechanic.
Yeah, auto mechanics,
woodworking. Yeah,
home ec.
I went to two. I think it was complete 2 years of woodworking.
And you have
When
all
I
10
was a
digits still?
junior. I do.
Ah, damn. Good deal.
Now, there was a guy in my class that cut his finger off.
Oh, yeah?
But it wasn't me.
Yeah, well, there you go.
Well, so one of the interesting, this is just a side note, the Micro Theo Von podcast, they're talking about the vacuum of people that are willing and able to work in the United States with bringing all the manufacturing back.
Mm-hmm.
Apparently manufacturers are having not an easy time finding enough people to work.
They're not. I can speak from firsthand knowledge of the two large manufacturing companies over in my hometown. My mother works at one of them, but she's high up in quality control, and they're having to ship people in from like Tennessee. Like they'll ride buses from like Southern Kentucky into far away, hours away to come work because they can. And unfortunately, these people, well, I don't want to say unfortunately, maybe great guys, but they're kind of non-hireable for most things. And so they get them to come up. To do some of this manufacturing work because like you said, they're having problems getting people to actually do the work.
I think this is part of what robotics could potentially. I mean, if we have a mission in a united.
But then we have to talk about kind of like a universal income of some sort. That's a conversation that we're going to have.
No, I mean,
separately.
It's not a one-day conversation. It's an ongoing conversation because we don't have the answers.
But yeah, manufacturing is dying, and I don't even know why. There's a lot of people out of work or that don't make enough, and manufacturing can make you that. I think I hate to say it, it's like work ethic. I think a lot of people don't want to. A hard day's work.
That's absolutely true. The children that are graduating from high school now have very little work ethic. And because it's all been gimme. And
well, it's virtual. They live in a virtual world, and they're inundated with messaging and what's supposed to happen when you graduate, and what the world is supposed to be like. But you're right. I mean, and let's just say it. COVID didn't help that because they told you to go inside, don't do anything. The screen time epidemic.
Well, they're being told by their teachers as to what they should expect to earn.
Yeah.
And
100%.
That doesn't make any sense.
So, I mean, I think this clip, if a lot of people are listening at the end, I know. And so if you have a chance to go back and watch it, basically it has kids working outdoors on a farm, getting dirty, doing things,
learning,
being outside and getting the vitamin D, even if you can do a classroom outside. I mean, there's health aspects, there's all kinds of different things going on here, but at the end of the day, the curriculum and what we've been doing to our kids for the last 30 years has created where we are. So lack of work ethic, lack of whatever, we're smarter than we've ever been because we have access to all the information. So it's not about education, it's about an evolution, and we got to figure out a way to get through it.
Well, 2 of the top 5 dream jobs were polled on high school age children. I think this was 2 or 3 years ago, but I was reading something on this. 2 of the top 5, one is being a professional gamer, and one is being a professional influencer.
Mm-hmm. Yeah.
Those are 2 of the top 5. Like, anyway, I just thought that was crazy.
The military is recruiting gamers. For everything.
Yeah, so
fly their drones.
Yeah.
I mean, there is a lot of that. I mean, so there is some potential.
But the influencer I guess one is more the one that got me.
Influencer.
That's what you are.
People make money, just telling people to go do whatever else what they tell them to do. Pretty much, yeah.
I'm not sure we're smarter. We have access to more data.
That's true.
Yeah.
But what do you do with it? What do you do with the data?
Yeah. The ability to process it is gone.
Well,
or dwindled.
It has dwindled. So I mean, to me, I have an education degree, and I decided not to be a teacher for a lot of reasons. Part of it was the bureaucracy and all that, but since I decided not to become a teacher for as long as I've been thinking about education, I've written pages and pages in journals and whatever just about education reform and what's needed. And whenever I started my marketing media company, there's the online stuff really started. I taught myself how to build websites online. I didn't learn in college. They didn't have it in college when I went to college. So you have access to everything that you needed by clicking and watching a video. And I mean, you can go change a carburetor, like watching a video. You can fix the gun. You know, you can
They've
break
even
down your
got
gun.
brain surgery on there now.
Well, I mean, and me and David were talking about that on the way in there. The computers are, you know, robots will be doing a lot of that surgery in the not so distant future. So, I mean, there is that larger AI vacuum. Like, we have a window of time where more and more we need manufacturing people, but I think more and more it's going to become robotics are doing more and more of it. So then we're going to have another conversation about purpose and mission and what are we doing in this windows of time when Dr. Roy types of people, you know, that are 30 years younger don't have a need for that because AI is
Taking
looking at
away
the blood
their
work.
job,
It's
yeah.
it not because they're not smart people. It's because the pattern recognition that is in AI is better than any of the pattern recognition we can come up at this table. And it's a scary concept, but at the same time, you've got to lean into it and fix it. So, but I appreciate you guys. If you don't have any final words, man, I love this two-door concept of two docs sitting here. And I would love to lean back into some of the dental stuff that I feel like is on the health realm. I started some research back when we talked, after we talked the first time, and you went on a trip and our schedules got crossed, but I'd love to do that again. And you're welcome to sit in here anytime and give input.
Absolutely.
Sometimes Mondays, sometimes Wednesdays, depending on.
I don't normally throw a curveball at you guys, but I've got a rock concert Wednesdays.
What are you going to see?
I'm going to see Seven Dust and Stain.
I was going to say Rush is half.
No, unfortunately, Rush is.
Are you going to go see Stain?
Unfortunately,
you should go see Stain.
Breaking Benjamin. Excuse me, I said Seven Dust. I don't know why I said that. Breaking Benjamin.
Seven Dust.
And
That's stuff you put on your garden.
No, there is a band called Seven Dust that I love. Seven Dust, but
I put Seven
that might
Dust
be
on
banned.
there.
That might be banned before this whole thing's over.
No, I don't know. No, but I'm sorry. It's Breaking Ben and Stain. Forgive me. But,
all right.
Yeah, we can't do any music tonight because we've been banned from doing that. So, for those of you that are followed us all the way through, we greatly appreciate it. Hope to see you again on the other side. Love you all. We'll see you soon.
Have a good night.
Thanks, guys.
Take care.
Thanks.
Night.